आप सभी का आयुष समृद्धि की 479th माइलस्टोन ब्रेनस्टॉर्मिंग जर्नी में स्वागत है। हम आप सभी का तहे दिल से शुक्रिया अदा करते हैं और स्वागत करते हैं। मैं आदरणीय विष्णु प्रसाद शर्मा जी, बीके अग्निहोत्री जी, मेरे निशांत जी, महावीर जी, प्रमोद जी, सभी को प्रणाम करता हूं और श्रीराम जी, वैद्य श्रीराम जी को प्रणाम करता हूं और आदरणीय विष्णु प्रसाद शर्मा जी से प्रार्थना करता हूं। सबसे पहले तो आप सबको बधाई। विष्णु प्रसाद शर्मा जी हैं, अग्निहोत्री जी हैं, वार्गी जी हैं, जो हम लोगों की एक यात्रा थी उसको इंडिया स्टार बुक ऑफ रिकॉर्ड्स ने एक बार फिर रिकॉग्नाइज किया है। इसके लिए आप सबको कॉन्ग्रेचुलेशंस और बहुत बहुत धन्यवाद। मैं आदरणीय विष्णु प्रसाद शर्मा जी से आग्रह करता हूं कि वो हमें आशीर्वाद दें। प्रणाम।
हाँ, प्रणाम। धन्यवाद। रेस्पेक्टेड प्रोफेसर वीके अग्निहोत्री जी, रेस्पेक्टेड डॉक्टर पवन कुमार शर्मा जी, distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on psoriasis, advanced AYUSH remedies. It's the most important subject. Today we have eminent speaker, Dr. Nishant Shukla. I welcome you, sir, for this evening webinar on psoriasis, advanced AYUSH remedy. I welcome Dr. Devi S. Nair. I welcome Dr. Ajoy Kumar Pal to this evening webinar on psoriasis, advanced AYUSH remedies. Psoriasis is a worldwide problem. There is no specific remedies in any pity, but Ayurveda shows very, very good result. Very, very good result. So today we have very good eminent speakers are there. We are waiting to hear from them. And I also did research on psoriasis. Later, sometimes I will show this regarding how Ayurveda shows very good result in the management of psoriasis. Once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening webinar on psoriasis, advanced AYUSH. Thank you. Welcome again.
Much, sir.
Over to Pavanji. Namaskar.
Thank you. So nice of you, sir. Thank you very much.
Okay.
Thank you very much. हम आपसे भी सुनेंगे सर, लेकिन आज आपके अनुभव भी सोरियासिस पे जरूर सुनेंगे। आप बिना सुनाए मत अलग होइएगा। जय हो, जय हो।
ठीक है, ठीक है। थोड़ा देर तक रहिए, हम चैम्बर पर हूँ, लाइन का बहुत टिकट है। After 8, I will join again.
Thank you.
ठीक है।
So now I would like to request Professor V.K. Agnihotri, sir. He is on the way, on the move. V.K. Agnihotri, sir.
Thank you, Dr. Pawan Sharma जी। नमस्कार, धन्यवाद बहुत बहुत। सबसे पहले तो हम, जैसा कि आपने बताया और सबको सर्कुलेट किया है, हमारे इंडिया स्टार वालों ने जो रिकॉग्नाइज किया है आपके 778 वेबिनार, इंटरनेशनल वेबिनार्स को, उसके लिए आप सभी को, आपकी पूरी टीम, मशीनरी जो पर्दे के सामने है, पर्दे के पीछे, सबको बहुत बहुत हृदय की गहराइयों से बधाई। और ये सबके मिले जुले अथक प्रयास से हुआ है। आज की वेबिनार जो आपने सोरियासिस रखा है, जैसे कि प्रोफेसर विष्णु प्रसाद शर्मा जी कह रहे थे, उनका बहुत वर्क है, हम उनका भी स्वागत करते हैं। और विशेष रूप से सोरियासिस वो डिजीज है वेयर Panchakarma has got a wonderful hit, especially the Vastikarma and all that. Though skin diseases are always tough disease, every disease is very tough, but since it leads to itching, and itching itself a painful condition, our Ramcharitmanas Goswami Tulsidas ji described the Sharirik Dosh and Manas Rog, and there also in Sharirik Doshas he talked about the Kandu, Jhai, Sannipat, etc. everything. So today's webinar is going to be presented with a very, very important professor, our Nishant Shukla ji, to whom we have learned a lot. And he's always not only a great scholar, but also belongs to that Ayurvedic generations where Professor C.B. Shukla Sahab, our revered Guruji is there. So in that way, skin disease and their management by Ayush, especially by Panchkarma, and what next, that will be given by our distinguished scholars of today's webinar. So with these words, we thank you all. I am sorry that I am on the way. I was expecting that I will reach Haridwar from Pune before starting off our webinar, say 7 p.m. But due to some jam on the road, it took more time, and I will be reaching about 8:15. So thank you very much, and we will be listening as long our this mobile battery will continue, and then we will just get it charged. Thank you so much. On to Dr. Pawan Sharma ji. Pawan Sharma ji.
Thank you very much, sir. Thank you very much. आप मूव पे हैं, फिर भी हमारे साथ हैं. आप लोग हमेशा ही साथ दिए हैं, इसलिए यात्रा यहाँ तक आई है. मैं आप सबको बहुत बहुत धन्यवाद सर. मैं अब हमारे प्रिय वैद्य निशांत शुक्ला जी को आमंत्रित करता हूँ. वैद्य निशांत शुक्ला जी एक जाना माना नाम, हेड ऑफ द डिपार्टमेंट रहे हैं, आज भी हेड ऑफ द डिपार्टमेंट ऑफ प्रोफेसर हैं अंधा पार कॉलेज में. वेलकम निशांत जी, वेलकम, स्वागतम.
थैंक यू आनंद जी. थैंक यू शर्मा जी.
जी प्रणाम जी.
प्रणाम. आज जैसे सर ने कहा वैसे भी मैं भी आज ही बाहर स्टेशन से आ रहा हूँ. आई वॉज ऑन द वे. मैं वेकेशन पे था और आज ही मैं अभी अपने घर नहीं पहुंचा. अभी मैं एक जगह पे शादी पे हूँ और वहीं से मैं अपना ये शेयर कर रहा हूँ.
अरे गजब.
मोबाइल पे है थोड़ा जो है ये. यस सर.
सैल्यूट टू योर झील. सैल्यूट रियली.
नहीं ये तो जो सर, मैं तो कुछ नहीं कर रहा हूँ. मुझसे जो बड़े हैं उन्हीं की दिशा पे मैं चलने का प्रयत्न कर रहा हूँ. सर अगर इतनी एज पर ये ट्रैवलिंग करते करते ज्वाइन कर सकते हैं तो मैं तो उसकी कंपैरिजन में बहुत छोटा हूँ.
बहुत खूब. गॉड ब्लेस यू.
थैंक यू वेरी मच. आज मोबाइल पर हूँ, थोड़ा जो है ये शेयर करने पे थोड़ी जो है वो मुझे देर लग रही है. मैं अभी जो है ये अपना स्क्रीन शेयर कर रहा हूँ. So now let's start. As narrated by the introducer, Agnihotri sir, this is really a big problem. And when we speak about the skin disease, the two disorders that comes to mind, and that has the emergency condition, they have the grave outcomes, and one of them is pemphigus vulgaris. I remember the case my grandfather used to tell at many of the places that the lady that has been admitted in the Ayurveda hospital, and during the routine round there was no major problem, but once he came and completed the rounds and sat in his OPD, the nurse came to call him that there is an emergency of the patient admitted with the pemphigus vulgaris, and that had a very critical issue with that patient. So when we come across the skin disorders, the two important, there are many other problems which have the critical and the fatal high fatality, but two most commonly observed problem is the pemphigus vulgaris and the psoriasis. Psoriasis is oftenly having the low fatality. The severe form is observed in approximately 1 out of the 5 patients. But the patient continues, patient has a lifelong problem with the disease. And to create the awareness and use the holistic approach, the Ayurveda medicine, if the patient comes at an early stage, if the patient comes for the Ayurvedic management in the first year of the onset of the disease, then there is a possible cure. When we use the word cure, that means we mean that there is a complete remission of the pathology. That is the Khavaigunya and the establishment of the Prakruti, that is the Prakruti Sthapana. The word has been narrated as a synonym of the Chikitsa. Chikitsitam vyadiharam pathyam sadhanam aushadam prayashchittam prashamanam prakruti sthapanam hitam. This is the opinion of my grandfather, Dr. C.P. Shukla, that the disease can be said to be cured if there is establishment of the original status of these tissues, that is the complete histological remission is established with the help of the medicament or the procedures, then and then a disease can be considered as cure. And with these lookouts, when the problem, the patient, we may help the patient to reduce the problem. The scalp is reduced, the routine activity is established, and the normal work he is able to do without any problem, without any worry. There is no apparent lesion. So if the patient comes in the first year of the diagnosis, then there is a possible cure. But what happens to us is that the patient first roams around the different medical centers, then after the problem has worsened or there is no satisfaction with the stress, worry, already the patient was in the worry, that is the cause of the disease. The treatment has not helped him to reduce the problem. The patient is on the steroids, which is again, if it is having the problem of itself, the medication creates the problem. So with all the knowledge, the patient comes to us after the disease becomes chronic. Usually the patient comes to an Ayurvedist after 2 years or 3 years, or at times 10 years of the diagnosis of the psoriasis, and there the problem begins. We are able to control the symptoms, but we are not able to cure the
Dr. Shuklaji, your slides are not moving.
Yes, I am just moving to this one.
Okay.
This is the introduction. That's why I have just stick to this one.
Okay. Kindly take your own time. Please.
No, I am just moving to this one, next one. So I have just made my presentation in a way, first to describe the pathogenesis and the Ayurvedic viewpoint, the management options that are available in the Ayurveda, and how to utilize the Ayurveda for the betterment. So in this way, I have made my presentation. So this is my brief biographical sketch. Now coming on to the definition, as narrated by many of the scholars, that is a complex and multifactorial inflammatory disease. Now, when we see the treatment part of the Tvak dosha or the Kushta in general, though the Charak and Shushruta described all the diseases, but in end, the opinion is that one need to consider the stage-wise changes of the doshas, and all the 3 doshas are involved. So the treatment is done as per the condition of the patient. So there is a generalized treatment measures, and the Gandhaka is the most important medicament that I will be dealing with in the afterward. But the important one is that there is a complex and multifactorial disease. There are more than one factor which is involved in the disease process, and that is leading to the incurability of the disease. Here we need to consider the Avran as well as the Ashaya Apakarsha. How we can consider, I have not developed my complete idea, so I won't describe here. But I am on trying to understand this mechanism, how this is involved in the disease process, how the formation of plaques and the increased generation of the cells happens. So we need to consider that also. So there is a hyperproliferation of the keratinocytes in the epidermis. So the increased increased number of the cells and a rapid progression of the dermal cells is leading to the condition known as psoriasis, that is forming the typical plaque. Now moving on to this slide number 3. Now, sorry. Now coming to the presentation, typically it is the erythematous scally area that is presented with the scales, typically like the scales of the fish. The scaly redness, some area usually occurs on a sudden onset. Redness is not a usual phenomena in a plaque psoriasis. Pain is usually not a usual phenomena, but once it is associated with the traumatized plaque, then or in the joint, then the patient may have the pain. Now here, one comorbid condition is observed as an autoimmune mechanized disease, that is the psoriatic arthritis. Patient develops the psoriasis as well as patient have the joint pain, and this is typically diagnosed as the psoriatic arthritis. Both the conditions are psychosomatic in nature, and they can be managed very effectively with the Ayurvedic medicines, controlling the plaque one and controlling the joint pain, and restoration of the joint arthritis is possible with the Ayurvedic medicaments. The pruritus is usually not observed, but in eruptive type or gutted psoriasis, this is often observed. It may happen that it may be misdiagnosed with the lichens or lichen planus. Lichen planus is a infective condition, whereas where there is a typical lichenized plaques are there, and whatever the patient I have seen of the lichen planus, they are the goldsmith. The acids are the important cause for the changes, the lichenization. So the lichenization in that one, or the gutted psoriasis, the pruritus, that itching may be observed. Usually afebrile, but if there is a inflammation, then one may have the fever. So these are the different conditions what we may observe in the cases of psoriasis. This is known to all. I am just moving on to the next slide. These are the different types of the psoriasis. This is the last one is the psoriatic arthritis. This is the dystrophic nails, the two pictures in the middle. So there is a typical lining observed in the nails, and the scaly area, the two scaly area. There is two type of the scales. One is with the scale, and other one is the gutted form of the psoriasis with the red tinge. Now, what are the important characteristics? Usually it runs in a chronic course. The patient may have the problem for years together, and this condition may be harassive, and the patient tries different way to hide that conditions, hide that lesions. But the disease runs in a chronic course. If the disease is managed properly in the first year of its occurrence, then there is a possible cure. But if it is not there, then with the use of the different type of the topical applications or the immunosuppressants or different medicaments, that is suppressed, the expression is suppressed, and the patient, the condition, the skin condition runs in a chronic course. That is a non-contagious, it is not spreading through the contact. The characteristically, it is presented with pink macarious scales. It is a multifactorial inflammatory disease of the skin. It affects all the age groups. It is having the autoimmune and mediated by the T cells and lastly, it is idiopathic in majority of the cases. So we need to consider the age of Vishwansa here. Now, what is the cause of the idiopathic? The mechanism is not known. The specific cause is not known. When we want to search the specific cause of any external agent, there is no specific external agent found to be responsible for occurring this inflammation. But when we see Ayurveda, we are focusing on the changes in the changes of the internal environment due to the external factors. And with this perspective, when we see, we have the different causes that is listed in the Charak, Shashwata, Madhav Nidan, etc. And everyone is knowing, so I am not dealing with that one at this point of time. But the Papa Karma, which is narrated, it is of the importance. So when we want to manage the condition, we should have, or we ought to have that part of some dana or etc. or some chanting of the mantra that could help to pacify this condition, to correct this idiopathy, or to pacify the shrap or that malefic effect of the different things. Now, when we want to know the severity of the disease, as I have narrated, the disease is oftenly observed as a non-severe form. 80% of the patients is not having the severe medical condition. They can continue their routine activity. Only the thing is that they need the proper oilation to reduce the lesion, and certain medication to control the medical condition. In 20% of the cases, one may have a very severe form of psoriasis. I'm moving on to the next one. So these are the different subtypes of the psoriasis: the plaque psoriasis, inverse psoriasis, erythrodermic psoriasis, pustule psoriasis. In that, there is a pus formation, and if this happens, then there may be the added or the opportunistic infection. There one may have the symptom of fever. The gutted psoriasis, already I have told, that is of the lichen. So that is similar to the Kitib Kushta, and the plaque psoriasis is similar to the Ek Kushta. Now, this is the Aspis sign. I am moving to the next slide. The histological signs, that is for the diagnosis of the medical condition. Why I am taking this one here is that when we are planning the treatment, we need to understand how to revert that one, how we can select the medicament or select the procedure for the reversion of this one. That we often tell is that sorry, Samprapti Vightanatmak Chikitsa, that is the regular acanthasis of the epidermis, thickening of the epidermis, and elongation of the rate. Then, sorry, keratinization characteristic of the retention of nuclei in the stratum corneum, and abscess or the collection of neutrophils in the stratum corneum of the epidermis. So these are the some histological sign that is observed in the microscopy. So this we can take for considering the treatment part. I'm moving on to the next one. This is the changes I have taken from the net to understand what are the changes as observed. See, if the first one image, there is a accumulation of the increased number of cells. There is a rapid regeneration of the cell. The healthy cells before the normal decay or the normal death period, the new cells are formed, and that leads to a typical plaque formation. The second image shows the involvement of the neutrophils in the disease. The third one shows how the pustules are formed, and last one, the micro abscesses which are formed leads to the plaque formation or the gutted or lichenification. What is egg kush? Now we want to consider the Ayurvedic counterpart. As per Shushruta, Krishna Aruna Yena Bhavet Shariram Tad Eka Kushtam Pravadanti Kushtam. So it is blackish which is of the plaque characteristic is considered as Eka Kushta. Now the Charaka described Asvedana Mahavastu. There is changes in the perspiration. There is a changes in the epidermis. The normal sweat formation is reduced in the area, and it is of a big, large skin lesion formed, and it is of the characteristic of the skin of the fish. Yan mat sakalopamam tad eka kushtam. So this is the eka kushta as per the Charakas. Now we want to, when we see the Shushruta's opinion, the Shushruta opinion is limited to the external presentation. When we see the Charaka's opinion, there is a changes in within the epidermal tissues, and the mechanism of pitta, the mechanism of sweda is also disturbed in the disease, which is leading to this medical condition. Moving on to the next slide. Now the other condition that we correlate with the kushta is the Kitaba kushta, that resembles the lichenified plague or the gutted psoriasis. So we roughly say that the Eka kushta is similar to that of the plague psoriasis or extensive psoriasis, where one is having the characteristic of exfoliation, and when there is a lichenification, the other one, that is the Kitaba kushta, is that which is of ruksha, kharasparsha, kandu, and parushata. So this is the description of Vagbata, that the hardening, roughness, developing of the roughness in a specific area or the lesion, it is considered as Eka kushta. Now coming on to the Charaka's description, Shyava Kina Kharas Parsha Parusham Iti Vasprutam. So when we touch this one, there is a typical roughness, and the parushata, that is the hardening of the tissue. So there is a involvement of the vata in this specific kushta variety. So that is a limit similar to Gajacharma, that is the skin of the elephant, or it is like the lichenified plague, or it is just like a gutted psoriasis. Usually that is a round, irregular form, dark, hard. Now coming on to the general management principle, this is I have taken from Charaka. I'm not going in detail of this one. This is already known to you. So first of all, considering this sadhya sadhyatva, and after that one, according to the involvement of the doshas and involvement of the condition, one should take the medicament. Sarva tridoshajam kushtam doshanam tu balabalam. So while planning the treatment, what we need is that the individualized approach of the management and the conditionalized approach of the management. So there is two things that we need to observe. We cannot develop the SOP just like the what we see in the medical system. There is a algorithm, treatment algorithm, but there is a algorithm in Ayurveda will become a complex. So we need to understand this, the dosha bala, characterize identifying the characteristics of the doshas involved, the dhatus involved, and as per that one, treat the vata, treat the pitta, treat the kapha in all form of the different type of the kushta. So दोषस्य यत् पश्यते कुष्ठस्य विशेषलिंगम अदृक्तम तस्यैव समं कुर्यात् ततः परं च अनुबंधस्य. So whatever the anubandha and anubandhya, consider that one and treat accordingly. This is the last one. The Maruta Kapha Kushtanam Karmoktam Pitta Kushtanam Karyam. So this is how one should do for the management of the Kushta. In Bahudosha, Charaka opines that the Shanshodhana is the important. Just before my speech, the introducer has correctly said that the Panchakarma is of the use in treating or managing the condition psoriasis. When there is a Bahudoshata, then there is definitely a role of Panchakarma procedures. It may be Vaman, it may be Virechan, it may be Basti, it may be Shiror Virechan, or though Rakta Mokshan is not considered as the Panchakarma procedure, but that may be also be included under this one when we want to consider as the Shanshodhanam. Then the cutting out the Bruhana Basti or Sneha Basti and these four Panchakarma procedures, that is the Vaman, Virechan, Niro Basti, Nasya, Siro Virechan, and the Rakta Mokshan, that may be included or that may be done as per the condition of the patient. So what it is to be objected, how we should take care, how to plan the treatment, that is narrated in the second stanza. Doshe hi ati matre hate vayu anyat balamashu. So we need to check the vayu and then the other dosha. The similarly is with the Vagbhata Chikitsa. Doshe hante अपनीते रक्ते बाह्य आभ्यंतरे कृते शमने स्नेहे च काले युक्ते कुष्ठम अतिवर्तते साध्यम. So considering the rakta dosha, the importance is given is the rakta in the Vagbhata. So one may use the different shaman and the shodhan treatment for the kushta. When we want to find out the specific or the single drug, the Gandhak is of the drug. Gandhak is the drug of the choice for managing all form of skin disorders. There is a description of Lilitaka Prayoga, Rasena Jatya Samakshikam Param, that is also with the Makshika, Makshik Dhatu with Mutra. So the in different form, the Gandhak may be utilized for managing the Kushta. Shrishtam Gandhak Yogat, Suvarna Makshika Yoga Dva, Sarva Vyadir Nibaranam, Kushti Rasam Nigruhitam. So the Gandhak or the Lilitaka, it is the drug of the choice. It may be used as an external application like Gandhak Dhruti or Gandhak Malhar, or internal application with Gandhak Rasayan or Arogyavardhini or Chandrakala or something like that one. There is an important indication of the Shodhana in the skin disorders. Vagbhat narrates that Ruddha Vagbhat, it is from the Ruddha Vagbhat, Pakshat Chardayan. So every 15 days, the person should be subjected to the purification therapy and that of Vamana. Now in this one, I am of the opinion, I may be wrong, I just I am just trying to open a discussion on this issue, that when we want to see the doshas, what we do is only the planned procedure of Vamana. In my opinion, as the doshas throughout the body, vitiated doshas circulating throughout the body and taking the doshas to abdomen at a one time, that may not be possible. So with that opinion, we would we would be taking out some doshas at one day. After 15 days, when the doshas gets collected into the coast, then eliminating afterwards. So every 15 days, this Shigra Vamana that may be utilized, just not like the what Vaman procedure that we do, the general practice of Vamana. Instead of that one, eliminating the material out, that would be the better option with the use of the emetic drugs. Shuddha Murdani, Triratrat, Triratrat. Shashte, Shashte, Asruk Mokshanam Cha. So every 6 months, one should go for the blood transfusion or the Rakta Mokshan. One may even go, it is difficult one to let the blood out. So that may be the possible with the help of the BT procedure, that we take out the blood. It may not have that significant effect like the Rakta Mokshan, but it will definitely reduce the pressure of the doshas. So this is my opinion. So I'm moving on to the next one. Now, when we want to improve the disease, when we want to have the improvement, we need to increase the ojasa, the dhatu shaitilya or the ojas tushti or the vishransa of the ojas. Now, if there is a increased vitiation of the ojas or there is a increased dhatu shaitilya, then there will be increase in the dosh in the disease and vice versa. So trayo doshaha yukpat prakopam apadyante tvak dosha chatvaraha shaithilyam apadayante. This shaithilya, it is this dhatu shaithilya, the natural host defense mechanism of the skin blood. It is leading to this morbid condition. And if this health of the skin is regularized, the host defense mechanism of the skin is regularized, that is the shaithilya of the dhatu, the rakta, the twak, rakta and mansa, then there will be decrease in the symptom of the disease and the cure. So the considering the autoimmunity with Oja Vishransa, I'm not going in the details of this one. I will take one more, or once the chance comes, I will deal with this on autoimmunity. But this is open, and I would like to have the different opinions on this one, what I have just narrated. Now, coming on to the treatment objective, the treatment triad is there. Devyapashray Chikitsa, Sattwavjay Chikitsa, and the rational medicine. These are the different treatment approaches, the medicaments, the external application, bloodletting, panchkarma. Why to consider Ayurveda? This is the holistic approach of the medicine. So it is not about reducing the immunity or reducing the skin lesion, but we want the whole body to be nourished, and the changes we want in the whole body, the whole natural host defense mechanism, the autoimmunity, which is triggering the mechanism of increased proliferation of the cell, keratinization of the cell. We want to reduce that one. This is the external presentation of the internal morbidity. So we want this holistic approach, and not only to reduce the external lesions. So why we should look into the Ayurveda and what we should do, that is the holistic approach of the medicine. Moreover, all the three aspects of the life, that is the sattva, atma, shariram cha trayam etat tridandavat. So to manage all the three aspects, as there is a autoimmunity and there is also a psychosomatic involvement of the disease. So we need to correct the psyche and the soma. There are the different treatment modalities available as per the condition of the patient. Detoxing the body, it is the only available in Ayurveda. So we need to focus on the Ayurvedic treatment, and this can be used with the external application. So these are the different modalities. Now coming to the facts. The disease is palliative in nature. We should accept that fact. Before giving the treatment, we should accept the fact that the disease is palliative and the treatment may require a lifelong, or managing the symptoms would be the priority. So what is to be done? Reducing the suffering. So when reducing the suffering, whatever the presenting symptoms are there, that should be reduced. The normal homeostasis ought to be maintained. The normal homeostasis mechanism of the skin, normal homeostasis mechanism of the body is to be maintained. Good aesthetics is of the importance. So if there is a lesion, we should give the external as well as the internal medication or the bloodletting for the subsiding of the apparent and the healthy, looking to the healthy skin. Improve and maintain the general well-being, improve general health, good health, and positive well-being. Thank you for a giving me the chance to share my views on the important disease. Thank you, Pawan Sharma ji. Thank you, Agni Hotri ji. And I am also thankful to the august audience that they have given me the chance. If there are any questions, I would try to justify those questions.
Thank you very much. Thank you, Dr. Nishan ji. Thank you very much. आपने बड़े अच्छे ढंग से समझाया, और these all experiences are inspiring for next gen. So I would like to request
Thank you very much, sir.
to please motivate next gen also for joining. Excellent. Thank you.
Sure,
you very much.
Thank you very much.
Now I would like to request Dr. Devi S. Nair. Welcome, Dr. Devi. Am I audible to you?
Yes, sir.
Welcome, madam.
Namaskar.
Namaskar. Swagatam.
Thank you so much, sir, for giving the opportunity. So all experienced people are there in front of them. I just want to bow and thank you so much, sir, for your presentation. And whatever, like my understanding based on that, let me express. Shall I share the screen, sir?
Sure, you can.
Sir, the screen should be closed, then only I can share.
Okay, I'm doing this.
Okay.
Now you can share, Dr. Devi.
Is it visible, sir?
Yes. Very nice.
Okay. So with the blessings of all my gurus, I would like to start my presentation. Psychosomatic approach on psoriasis. To start with, actually, today is the World Psoriasis Day to support the patients, those who are suffering. Actually, it started by the National Federation of Psoriasis Association. So for every year, They are actually working for the people of psoriasis. So theme of 2022, based on that, I just want to do the presentation is on the mental health. So they put forth with the concept that the psoriasis is actually creating a stigma in people, that itching, and there will be the lesions which make the people, okay, no need to go near that person, it's looking awkward. So all these things have created a stigma. Along with that, the last year corona is also another reason the people has more gone to more mental problems. So because with this intention, they have gone actually with the theme mental health. So when you see from Ayurveda view and also from the new research, actually this mental health is not a something which is created from the psoriasis. Instead, actually it's a loop. So mental problem or our stress is creating or is acting as a nidana for the psoriasis. And this psoriasis again producing such changes is producing again mental illness. Then again, this mental illness is going to aggravate the condition. So this is the reason why the roga is actually becoming more yapya in nature. So understanding of the patient that this loop is working is very important. Maybe in the starting stage, so that you can prevent. This can be given as an awareness to every sectors, every working sector, or at home also. Make it as an awareness so that this can act as a trigger for creating the initial or starting of this issue. And once it started also, your stress level is very important. Otherwise, again, this can act as a continuous condition nidana for further aggravation and making it more deeper. So this will be explained later in the slide, what is the importance of the psycho part. So now coming to the history of the disease. So understanding of the history is always important. So many acharyas in the modern like science also has contributed. So Hippocrates, from Hippocrates, then Celsius, then actually they developed the dermatology branch from Robert Villen, whose picture is there in the topmost part. Actually, he developed, there should be a separate skin, you have to concentrate and treat. But they all told everything as a part of leprosy. They were unable to differentiate it from, they considered this as an infectious condition. They were unable to differentiate it as a separate condition. Then Hebra, he has got a Atlas of Skin Diseases book, which is now also available in Amazon and all. So he is considered as the father of the modern dermatology, where he separated it and told it as a separate condition called psoriasis, not an infectious condition, not a contagious one. So he told in his, with his picture is kept, the down picture is the Dr. Hebra. So he has told white scales piled upon on top of each other in his book. So like that it started. So now when you see how the basic Utpadaka Nidana, how it is producing is still unknown. Modern world, they are telling it is still unknown, maybe genetic or some immunity related changes. So when you see the triggering factor is very clear, the person who is having stress or there is a trauma, repeated trauma in an area, then infections can also trigger, then the cold weather and dry climate, then the food items, alcohol, fermented drinks, smoking, then some medications like repeated application of the steroids on a part, which can reduce the immunity of the skin, then progesterone hormone therapies, then other drugs like anti-malarial, blood pressure drug and all, continuous use also is affecting the blood vessel and blood. Now coming to the pathophysiology. So pathophysiology, there is the formation of the skin, the layers which is happening from the corneum basal. So from the corneum basal, actually the layers will be formed and it will be going up, and within a 2 week to 4 week gap, it will be removed. It will become dead and the dead cells will be removed. So if it is not getting accumulated in the layer called stratum corneum. So here what happens is, because of the nidanas, The inflammatory, not only inflammatory, the immunity. Immunity means the normal working of the body. So that homeostasis is getting affected. So the T cells usually stimulate the B cells, but without any reason, here the T cells is stimulating the B cells to produce auto antibody, and this is affecting or killing own cells. So this, along with this, there is an excessive cytokine release. You know how cytokine storm is affecting in corona is very common, like sudden death is happening because of the overreaction of the body by production of the cytokine. Same way here, death is not happening, but cytokine release excess will produce much inflammatory changes in that area. So this is happening in the skin, not in some lung or heart or something. That is why it's not creating a mortality, but this creates severe morbidity. That is, this T cell stimulate the B cell and auto antibody be produced, and another one is cytokine release. So as a result, the inflammatory process is happening. So because of this, more and more basal layer will get stimulated, and this will be more and more will be keratinized, and this keratinized dead cell will be deposited, and large quantity deposited, which is producing the scaling and thickness, and this will be shed prematurely. As a result, you are getting the discharge like scales, and this also irritate the skin, producing severe itching. So this can happen in any areas of your body based on what type of psoriasis you have got, or which usually the extensor surfaces are affected more than the flexor areas. The flexor areas, usually the area where sweating is maximum and all, where you can see the inverse type of psoriasis. So let us see now what all are the sites and how it is seen. So morphology, so identification and diagnosis is easy if you clearly see the lesions, because this type of lesions are seen in many conditions like pityriasis, lichen planus and all. So there also it will be completely spread. So here if you see, there will be erythematous, red colored conditions. Then another one is very demarcated margin you can see, and it is somewhat round. And there can be papules. Papule means the protrusions, like bumps will be formed, and plaques also can be seen. Then it will be covered. Above this, it will be covered with mica, like scales. So that will be shown in the last picture, and it is having severe itching. So the patient will be going on itching, and there will be some white discharge will be going on falling off. From this, we can understand. So some of the phenomenon which is seen only for psoriasis, which we are going to, if you want a confirmation, because we don't have much blood test and all, only biopsy is the confirmation. So no need of any other test. Actually, it's very clear from the physical examination. So the Koebner's or isomorphic phenomenon, that is, a trauma is happened in same area, a skin lesion can be produced with same resemblance of the lesion, like the trauma area. That is called as Koebner's or isomorphic phenomenon. Then you can see a ring of peripheral blanching, white color around it, which is seen in few conditions, which we call it as Voronov ring. Then when you try to take off or using a knife or some mild things, should try to take off the scales, then you can see some candle wax like thing will be coming from the topmost layers, which we call it as candle grease sign. So this greasy scales is the micaceous scale. The next is, after when you remove the scales, there will be a very thin membrane. Okay, so simply the thin membrane will get break off, and small bleeding spots you can see under that scale, which we call it as Auspitz sign. Then coming to the different types of psoriasis. So the plaque psoriasis, the one type which is most commonly seen, where scales can be seen very clearly. It's a progressing one. Symmetrically, you can see in the extensor areas, sharply demarcated and a bit moist. Now coming inverse. Inverse is a bit different. Here I told, instead of the extensor area, the flexure area where the flexion is happening, that area usually we will sweat a lot. And when you have a very big thigh or you are very obese or fat, then your thigh, then your different areas like your stomach folds and all will be rubbing each other. So that time, and because of the increased sweating, you can develop, because of the continuous irritation, you can develop with the inverse type of psoriasis. So that is the area seen is different axilla, groin, the navel area, this under the breast and all. Now coming to the gut-type type of psoriasis. So gut-type type of psoriasis, gut means drop-like. So it is like some drop have fallen. So this type of psoriasis, if you are getting, it might confuse with the other type of skin diseases because previous type and all, it is very clear. So this usually patient will tell suddenly it started. Maybe it is triggered. The triggering factor will be some infection you recently developed or some injury you recently developed. So here there will be so many papules which will be just dispersed all over the body and it is very small. So in younger age, you can see this type like eruptions formed. Okay, but we can differentiate it from other conditions, like there won't be any other fever or other condition. So one thing like secondary syphilis also, it is somewhat similar. But when you check the other lakshanas of syphilis along with the PCR and VDRL, you can diagnose it. Then pityriasis rosea also were the Christmas tree, like the appearance will be something different and it won't create much complaints like the psoriasis. It is more mild compared to this condition. And lichen planus. Lichen planus is another condition we used to get confused. That is also immunity related only. But lichen planus condition usually will respond with the UV light and also lichen planus condition, you don't have the scales. So from that, you can identify the condition. The next one is pustular. So any type of psoriasis can become pustular. That means inside there can be pus formation. So once it has become pustular, then it will be a bit painful and there can be associated fever, body pain and joint pains. Such lakshanas can be there. But still it is not a spreading condition. It is not a communicable disease. Now this can develop even to the ubadados, okay, the nail psoriasis, and even it can develop into the arthritis level also. So when you see the nail psoriasis, the psoriatic nail is easy to identify. You can see more whitish, thick condition. We call it as hyperkeratosis. So the stratum corneum will become very thick. That is why it has developed this. And under the nail, you can see some red dot called splinter hemorrhages. Then the thickening of the nail, the transparency of the nail will be lost. Onycholysis can be seen. That is the separation of the nail from the nail bed. And oil will be spilled over the nail. Like that oil spot can be seen. Then spitting of the nail, like pits will be seen on the nail. So usually which we identify or remember for students, we say stop, to remember the stop where all the points will come. So this is the nail level affliction. Now from Uttana, it can go even to the Gambhira Avastha, to the Madhyama Rogamarga, where the stiffness, especially in the morning. Then along with the psoriatic lakshanas, what we told, you can see pain and swelling on joints. Tendon will be really tender and swollen. So fingers and toes will be affected. Along with that, there will be nail changes and lesions also you can see like psoriasis. So in brief, if we get a patient, if it is not a pustular one, it's a pus-formed one, then candidiasis, and after that the membrane, and after that the spot hemorrhages will give you a confirmation of the psoriasis, and the types also you can easily identify. So what Ayurveda says, anything which is producing a disfigurement in the skin, we call it as kushta. Acharya told 7, 11 and all, but everything that whatever which is producing a disfigurement is nothing but kushta. So kushta is told as never it is a egadosha pragobaja. That means it can be the tridosha involvement surely will be there, but the degree, when you see the amshamsha kalpana, the degree will be different. So based on the degree of the three doshas, different types of kushtas can be understood. Now coming to the nidana part. So the nidana, when you see all the rasa, rekta, srodho, dushti nidanas, you can consider here. And most of the things, what it is not like ulpadaga, it is mostly towards the triggering factors is more clear. So when you see the new research works, so in the new research work, they are telling the intake of hot and cold is actually the viruddha abhyas of the Shida Ushna Akrama Sevana is going to affect the different blood vessels and blood, especially in the people who are having allergic tendency. Okay, so IgE affected people. So in such people, this tendency will produce changes which can trigger the psoriasis. Also, the cognitive response of the brain will be affected when you do this. Then another study, like excessive alcohol and fermented items, is told it enhances the production of the inflammatory cytokines and the keratinocyte growth. So this can cause a hyperproliferation. So the enzymatic defect also produce a ECT flare-up and rosacea. Such conditions will be increased when you take a fermented items. Then one more thing is vasomotor center of the brain will induce vasodilatation that can also act as a reason to exacerbate such redness and flushing condition in the skin diseases. So same way other Ushnaharas also research works are going on. So Snigdha Ushna Drava is the main three qualities which is going to disturb the blood, the normal recta constituents. Okay, so these three gunas has to be corrected in any vikaras of the recta. Then other nidana like chardi vegadharana, ajirna, adhyashana, adhisnebana, adhibhukta vyayama, garma srama bhaya, followed by shidambu sevana also act as a nidana. So in general, it is tridosha with tvakmamsa rektalasika affected. So Ayurveda understanding, you can see many diseases where the you can see the kinagaraspasha very hard type, like there is a wound and wound got healed, how rough it will be. Some type of callus formation you can see. Then Eka Kushta, also Matsya Shagalobama, like scaling is told. Charmakya also where there is thickening, hyperkeratinization you can resemble. Then Sigma, where Rajo Grishtam Vimunchari, when you itch, then you can see there is white discharge of powdery discharge can be seen. So whatever name you want to give, whether it is Sigma, Ekakushta, Charmakya, Kidima, when you see the dosha dominance, it is Vada Kaba. So what I feel is, even if it is Tridosha, all these lakshanas shows Vada Kaba has to be targeted when you do the treatment. So these are the different acharyas told the different lakshanas. So assessing the dosha dominance, you can use the chart what acharya told. Vada having Rauksha Shosha Todadi, Pitta with Daharaga Parisravadi, Kaba with Shaitya Kanduadi. So based on the dominance of the degree of the lakshana, you can think, okay, Kaba dominant drug should be added more when you make a combination. So Dadu level also analysis is very clearly told by acharyas from the lakshanas. Now Kushta Chigilsa. So everything should start with the Chigilsa Sutra. So Vadotreshu Sarpir Vamanam Sleshmotreshu Kushteshu Pittotreshu Moksho Rektasya Virejanam Chagre. So Acharya started it with a Shodhana therapy. So Rasa Rekta Dushti in a higher level where Shaga Gada from the dosha has moved from the Koshta to the Shaga. So Shodhana karma is surely should be done. Shodhana karma should be done, whatever the case of psoriasis may be. So instead of telling the concept, what Acharya told Vamana once in week and all, like repeated Shodhana is required because the dosha dushti is high level. And we have to slowly eliminate the Leena dosha which is present, which is in the Shakha level. Slowly we have to eliminate slowly by doing a repeated Vamana Virejanadi karma. And based on like high level of Rakta Dushti is there, a Rakta Mokshana also will help. So after Shodhana only any external therapies will give action. So initial stage, if you try to do any external therapies, it is of no use. Again and again, you are blocking the, or you are creating more Srodho Rodha in the condition. So preferably start with the Shodhana. Then once the Srodho Rodha is cleared, it's like reduction in the symptoms is seen, like hyperkeratosis and all reduced. Then start with the external therapies. Then only the external therapy will start responding. Otherwise, the heat will get again blocked and the inflammation will be increased. So now coming to the formulations. So Snehapana, usually when it is more itching and all are there in the patient and more thickness of the scales are there, then prefer Aregvada Mahatiktam, which is more Kabahara in nature. And based on the Lakshana, we can select the Panjatikta Grida, Tikta Grida, Mahatiktagam, Padoladi, and more Vadaja nature, like more Parisharuksha, Gugula Tikta Gridam, or adding Gugula Tiktaga along with all these Tiktaga as half also will be working well. Now after this, Abhyanga and then Svedana. So usually Svedana, mild Svedana is enough because this is a condition where Shaidilyada and Utklesha is there. So mild Svedana is enough. Now coming to the Vamana, normal Vamana drugs like Madanaphala, Kudaja, Yashtimadu in Padola Nimbakashaya will work more. Then if you want to do again a Snehapana, and then you can do Virejana Karma with Manibhadra Gula, Trivitleha, Vipatigara Churna, the usual Virejana drugs. Then a Samsarjana Krama. So after Samsarjana Krama, Shodhana and gain, the patient should gain the Agni Deepti and the Lakshanas like the Parisharukshada and hyperkeratinized, and the scales should reduce and the redness also will be reduced in the patient. So patient only will tell because of these drugs, it will act as a Shamana effect also, because all these Sneha what we told will have a Shamana effect also. So this will create a Shamana effect. Along with that, the Dushita doshas will be eliminated out through the Shodhana. So now you can start with the internal medication and the external therapies. So as a drink, you can give the Shariba boiled water or Gadra boiled water or a coriander boiled water added with a pinch of Shundi. Then Kushtagna drug process Takra and Shariba Panaga, which is told in the pharmacopoeia of a book based on Kerala pharmacopoeia. Then once you start with the Abhyanga, one of the most important practiced one is the Ayyapala Kera Taila, which is Aditya Pagavan, which is made with the Wrightia tinctora, which is considered as most effective in the condition. So Shweta Kodaja research work also has proved has a very good keratolytic action. So this should not be prepared in your stove. Actually, it should be prepared along with the Nimbapatra. It is put in the coconut oil and it is kept in the shade. So with the sunlight heat, slowly this will undergo Paga, and this has a very good action in the psoriatic conditions. So this is already available as a manufactured one, the 777 oil by the JRK company. So the lipid in that will reduce the dryness of the skin, cirrhosis, and itching will be reduced through application of this. And coconut oil has the action of cytokine and inflammatory reduction. So cytokine production also will be suppressed. So this will reduce the inflammatory, and very good change you can see in the patient. Within days, the patient will tell like the itching is reduced and the redness has reduced. The thickness of the lesion is also reduced. Also mild, like in the scalp and the body, the starting stage, Durvadi Kera is very like good action is seen. Even Alpamaradi, and you want a more hot condition like Vata Kapha is in a very high level, then Tuvaraga Taila also you can opt for. Now the Svedana, mild Svedana is enough. So after applying all these things, if you expose, after applying all this oil, if you expose under the sun, then it help the Brajaka Pitta to work more, and the absorption of the medicine to the deeper dhatu will be happening, deeper layer of skin will be happening. Then Kashayak Shalana is another one. So Vibha soap of Kotakil is very good, where Udumbar Ashwatha Negrodha Nimba Ushira Taila combination you can use as the soap instead of the normal soap available. Or if you want to wash it off with the Kashaya, Nalpamaradi and Panjavalkala are very good. Then more Ushnada, then Siddharthaka Snana Churna you can make, or even Epsom salt bath also will give good result. Lebana. Lebana can do as Lebana or as a Utkarshana by mixing the Siddharthaka Snana Churna with Takra. Then Lebana, so many labor like simple conditions in a localized area. Then Aragwada Twak application, which is commonly available in every home, or the Nimba Patra mixed with Navanida, or what rice we are using, the red rice has got very rich vitamin, mineral rich. So that application also, not only in the psoriatic condition, even any skin condition where the immunity is affected, has got a very good result. Now coming to the more Vada Lakshana is there, then Kashaya Vasti with the one combination which we used to give in our IPD where Panjatiktaga Niruha Vasti is written. So this has got a very good action in the circulation. Suddenly it will get absorbed in the rectal area. Vasti everyone knows. So this has got a very good action, reflects in the skin. Now Nasyam is not tried, but it is also told by the Acharya. Then Rektamokshana also can be done. Then internal medication based on the dosha dominance, you can select any of these internal medications. And now the patent drugs are also available, Prunilol, Prutin, Soracot and all. So the Manibhadra Gula, like any one Anulomana Vairajaniga drug can be regularly given in a mild dose to clear the blood toxins. Then skin immunity regulation, for that a regular intake of, after clearing everything, a regular intake of either Guduchi Sattva or Ashwagandha Churna or Rasayana Churna Vadi, which government only is providing as a government product, having Amla, Guduchi, Gokshura and Ashwagandha. So these all will work well. Then psychosomatic, that is the topic which we discussed first. Actually the stress, it is introduced by the Hansel. He defined it as a destabilizer of homeostasis. Actually, the stress, how much this is applicable, it is still research is going on, but still body prevents the destabilization by how the stress is producing skin problem. I just tried to make a reasoning. How much it is correct, even I don't know, but I'm just going through that. Neuroendocrine response to stress is now happening in the body. Maybe because of that, the hypothalamus pituitary adrenal axis is getting stimulated. So ACTH, including the thyroid hormones, will be affected, and this can produce usually a steroid. If you apply a steroid, it will produce anti-inflammatory action, anti-allergic action, and an immune suppressant action. So whenever in your body you are undergoing a stress, same way steroid will be produced in your body. So that time anti-inflammatory, anti-allergic and immune suppression will happen. But continuous stress, then what happens is this immune suppressant will affect the immune regulation in your body. This creates a autoimmunity. Once it has become autoimmune, then this creates problem in the skin. Not only skin, all the collagen disorders can happen. Okay, even uveitis, even this one, ankylosing spondylitis, such changes can happen. So now instead of anti-inflammatory, it acts as an inflammatory condition. So this might be the reason what I feel, how stress is producing a collagen disorders or such changes. So these are some of the studies. So in that, this cycle only is told. So the treatment for psychic factor is also very important. So along with what Shodhana Karma, Shamana Karma you're doing, if you can do some pranayama like Brahmari, Shitali, Shitkari, or child pose, Shavasana, salutation pose and all, then something which is creating calmness and reducing the stress factor, reducing the cortisol level, reducing the sympathetic activity in your body, like the Takradhara, especially the Shiro Takradhara, has a very good effect in psoriatic patients. So when you do the Shiro Takradhara, along with in psoriatic patient, very good result is seen, immediate relief, and repetition of the condition is also prevented. So Takradhara, everyone knows it's a pouring medicated buttermilk on the head area, like 6 inches above. So you have to keep a Dhara Patra above the forehead. So it should be done in the early morning in a very calm climate, calm room with closed eyes. Eyes will be covered with cotton pad. And how it is prepared is actually I've shown in the slide. So the milk should be based on what drug you want, especially Amalaki, Musta, Ishtimadu will be added, and it will be made into takra by fermenting it with dadi, and next day it will be churned, and if you want, you can add in this churning process Amalaki, Kashaya, or any medicine which you want. That Kashaya can be added and you can churn, and takra has to be made. So this takra pouring on the forehead, where slowly you have to move the Dhara Patra, and this Dhara on the forehead has got a very good action in the circulation and in the skin immunity. Okay, because it calms down the brain centers. So once it is done for half to 45 minutes for 7 to 21 days duration, then you have to wash the hair with Amalaki boiled water and dry the hair, put Rasnadi Churna just to prevent, because it should not create a cold and it should not create any respiratory problem in the patient. So Rasnadi Churna will be put. So this has got a clear action in the central nervous system, and it is commonly practiced and has got a very good result in most of the patients. So fat globules, it can cross the blood-brain barrier, and it also remove the blocks, and this warmth also is helping. Now, I just want to conclude that the psycho action of the psoriasis is very important instead of like simply treating the Shodhanadi. Shodhanadi is important. Along with that, if we concentrate on the psychic aspect also, like Murdhini Taila, Saraswadarishta, Ashwagandha, Brahmi compounds, and also Takradhara, if you do, and even Nasya, Murdhini Taila, Talam also will have action, but I don't know what all medicines will exactly act in the psoriasis in Nasya, Murdhini Taila, and Talam. That also has to be tried in the patient, and we have to come to a more better result oriented treatment. So I feel the psychic part has half role, like a Arthavasti we will tell in Vadarakta. So same way, psychic medicines have a half role along with the Shodhanadi and the skin medications of Kushta. So this is my conclusion. So thank you so much, sir, for the opportunity you have given. Thank you so much.
Thank you very much. Thank you very much, Dr. Devi. Thank you very nicely explained on and very specifically focused on psychic treatment. Very nice. Very nice. So now I would like to welcome Professor Arun Kumar Pandey, sir, Vice Chancellor, Mansarovar Global University. Now 2 speakers are left. Dr. Ajay Palji, welcome. And then I would like to request with Dr. Priyadarsani from Sri Lanka, and who has the practical experience on psoriasis, and then Professor Vishnu Prasad Sharma ji, who has the practical experience on that. So I would like to welcome Dr. Ajay Pal. Dr. Ajay ji, welcome.
Okay, welcome, sir. Welcome. Sir, can I share the... Hello?
Sure. Now you can. Sure, you can.
Okay, fine, sir.
Is there any problem, Dr. Ajay?
1 minute, sir. I will
Okay, no problem.
searching for that one.
Okay, I would like to welcome Dr. AYUSH Sharma, Chair, University of Mauritius, from Mauritius. Welcome, welcome, Doctor.
Thank you very much, sir, and a wonderful program. Really enjoying.
Thank you, thank you, thank you. Hope you have received the certificate also on WhatsApp.
Yes, sir.
Thank you, thank you.
डॉक्टर साहब नमस्कार, ईश शर्मा।
प्रणाम सर, प्रणाम।
नमस्कार सर।
नमस्कार।
नमस्कार सर।
नमस्कार डॉक्टर साहब।
नमस्कार सर।
शर्मा, डॉक्टर विष्णु शर्मा जी,
नमस्कार सर।
आप सभी को नमस्कार।
और कैसे है डॉक्टर साहब?
बहुत अच्छे, सब कुशल मंगल है।
अच्छा अच्छा, ठीक ठीक।
और हम देख रहे हैं कि हमारे डॉक्टर पवन शर्मा जी किस तरह से एक लंबी श्रृंखला इन्होंने वेबिनार की बनाई है और कीर्तिमान स्थापित कर रहे हैं, और गिनीज बुक ऑफ वर्ल्ड रिकॉर्ड में ये निश्चित रूप से इनकी ये वेबिनार सीरीज शामिल होगी।
अच्छा, नहीं, ज्ञान गंगा बढ़ा रहे।
गिनीज बुक वाले 4 महीने से लटका रहे हैं सर।
अच्छा,
हाँ, हम लोग अप्लाई कर चुके हैं, लेकिन वो बाकी सबने दे दिया, गिनी बुक वाले वैलिडेशन नहीं कर रहे हैं।
ऐसा क्यों? जबकि आपका तो ऑनलाइन है, सारा रिकॉर्डेड
हाँ,
है।
मेरा तो सब कुछ प्रूफ है सर, ऑनलाइन ऑलरेडी प्रूफ है। करेंगे, आज नहीं करेंगे, महीना भर बाद 500 में करेंगे।
थोड़ा समय लग रहा है, लेकिन होगा।
सर, डॉक्टर अजय पाल
whether it is visible, sir? Whether it is visible, sir?
No, no.
Oh.
Please share. Share button is in between the menu.
Yeah, yes, sir. But in document, it's not going.
Ajay sir, first you open it in the desktop slide. You can open it on desktop, then share screen.
No.
If possible, please share with Dr. Devi. Devi can play the PowerPoint.
Yes, sir. Yes, sir.
In the meantime, when this setting is being done, I would like to request Professor Vishnu Prasad Sharma ji for his practical experiences on psoriasis. Respected Vishnu Prasad Sharma ji.
हाँ, नमस्कार पवन जी। तो हम लोग का डिपार्टमेंट पर सोरियासिस का काफी सालों से, more than 15 years हम लोग रिसर्च कर रहे हैं, and we are getting very good result. Mainly हम लोग एक ऑयल डेवलप किए हैं, राइटोरिया टोमेंटोसा, मीठा कुटस। हम लोग के यहाँ बहुत अवेलेबल है, तो हम लोग उसका ऑयल बनाते हों और अफेक्टेड एरिया पर लगाने के लिए बोलते हूँ। तो लगाने के बाद हम लोग एक आर्थवर्म सॉइल होते हैं, उसका ऑटोक्लेव पर रख करके हम लोग व्यापार कराते हैं। एटलीस्ट डिपेंडिंग अपॉन लीजन 45-55 मिनट्स हम लोग ये कराते हो। कैन यू हियर माय वॉइस?
यस, क्लियरली सर।
हाँ, तो हम लोग को व्यापार कराते हूँ, और वो करने के बाद हम लोग देखे हों तो लीजन कमती हो जाते हैं और पेशेंट ठीक भी हो जाते हैं। हम लोग देखे हो तो 5 इयर्स फॉलोअप पर भी है, 5 इयर्स 10 इयर्स पर भी रिलैप्स नहीं हुआ है। कंप्लीट क्योर तो बोलने में दिक्कत है, लेकिन हम लोग ठीक करते हैं। और ओरली हम लोग ये दवाई देते हूँ, पंचतिक्ता घृत गुग्गुल, कुछ दिन के लिए सूर्यशेखर रस गोल भी हम लोग लेने के लिए एडवाइस करते हूँ, और उससे काफी रिजल्ट आए हैं, काफी रिजल्ट हम लोग को मिले हैं। यही है हमारा रिसर्च का, ये है। कभी हम मौका मिलने से नेक्स्ट टाइम कैसे पेशेंट का इम्प्रूवमेंट हुआ है रिजल्ट दिखा देगा।
इंटरनली क्या देते हैं सर?
इंटरनली सूर्यशेखर रस गोल्ड देते हूँ, कुछ दिन लगातार 1 महीना 2 महीना, ज्यादा लीजन पूरा होल बॉडी पर हो तो 2-3 महीना लगातार देते हूँ। और पंचतिक्ता घृत गुग्गुल, ये तो नॉर्मल दवाई है। सपोज कुछ सेकेंडरी इन्फेक्शन है तो हम लोग गंधक रसायन टेबलेट, मंजिष्ठा वगैरह भी हम लोग एड करते हैं, बट मेनली सूर्यशेखर रस, पंचतिक्ता घृत गुग्गुल और जो ऑयल बनाते हो ना, वो ऑयल प्लस अर्थवर्म सॉइल का वेपर, वो वेपर देते हूँ, काफी आराम हो जाता है। नहीं तो आदमी लोग स्टेरॉइड वगैरह लेते रहते हैं, और एक बार लीजन कमती हो जाए तो स्ट्रेस लेवल भी कमती हो जाते हैं, स्ट्रेस लेवल भी कमती हो जाते हैं।
बहुत ठीक बोले सर, बहुत
Dr.
ठीक।
Sharma ji,
हाँ,
you have given very valuable information. Now you mentioned about that Clitoria ternacea
हाँ,
you have used for preparing oil.
यस, राइटोरिया टोमेंटोसा,
Rhytia,
टोमेंटो, हाँ,
so that is the tree.
ट्री, यस।
So which
Leaf,
part?
we collect the leaf,
Leaf.
collect leaf,
Oil is
clean
prepared
it.
from leaf.
Yes. We take 1 liter of coconut oil, 1 liter of that leaf. We make small pieces of that, make the small pieces of that leaf, add on that oil, keep the tray for 5 days in sun rays. After that, we squeeze it and we ask the patient to apply that oil over the affected area, and along with we apply that nutrition with earthworm soil, and it shows very good result, very good result. Still we are doing along with
being a botanist, and I have worked on medicinal plants, especially collection, identification, and other aspects. So I know that this tree is very important medicinally. Now, the major population I have just joined, so I could not listen the lecture of other eminent speakers. But the problem which I have been seeing is of leukoderma, which many people, they are facing a lot of problem. So whether it is a possible, like that pigment, melanin pigment, because of the disappearance of melanin pigment, that creates problem, and leukoderma is there. So is there any cure in Ayurveda of
yes,
the
sir,
leukoderma?
definitely. If lesion is small or little bit, if all over the body is affected, then at that time very difficult. But otherwise, if the small patches are there, we use Bakushi, and it shows very good result. Along with patient has to follow the rules and regulation. But once
Sorelia coralifolia.
Yes.
Coralifolia.
Coralifolia. Along with other medicine, depending upon condition of the patient, we use medicine. It gives
good result.
It gives result, positive result. We are doing in my clinical practice.
Common CCRAS has researched on Tolenorm oil.
Tolenorm.
It is research product of CCRAS, Central Council for Research in Ayurveda and Siddha. They have launched a very good product, Tolenorm, which is now produced by, I hope, JRK Siddha. So these products are there.
So it is
Dr.
a
Devi,
combination.
are you ready? Dr. Ajay Palji?
I'm
DRDO
taking
has
little
also
delay, sir.
developed liquid
5
tea.
minutes I will rectify you.
Yes, please.
Hello. Sir.
DRDO
Yes.
has also developed.
Within 5 minutes I will rectify. I think I have taking little delay to connect actually.
No problem. No problem. Please take your own time. We can continue our discussion.
Sir, Sharma sir. Good evening. Sir, I want to share my experience regarding this psoriasis.
Sure, sure.
When we see the patients visiting our clinics, skin diseases, especially the psoriasis patient, they are psychosomatic disorder. Already it has been discussed by the eminent speakers regarding all those. But the word psoriasis is derived from the Greek word where itching is the main symptom. Along with itching, there will be redness and scaling. These are the scaling of the skin. These are three symptoms which talks regarding the cause of the vyadhi, that is Tridoshisha vyadhi. It is a Vata Pitta Kaphaja. But we have seen the patient. The patients are telling that the itching, what they get is, while they are itching, while the itching will be there, and when they scratch that particular part of the body, they receive a severe type of happiness. They say that we receive a happiness while itching. So khujane ke liye kuch chahiye bolte hain na, so they feel pleasure regarding when they itch that particular part of the body, which is Tridoshisha vyadhi we call it. And according to a recent the survey which is given by the National Psoriasis Foundation, it says that there is no cure for psoriasis. But in holistic medicine, we have seen the patients curing it by taking Ayurvedic medicines and following yoga therapy and all those. In Jamnagar, we have found a very good result on these. There are a number of patients who are visiting our OPDs, especially Rashastra, and also taking treatment for yoga also. Arpan Bhatt sir was giving yoga treatment. He was telling to chant Om, because the Om word is derived from three words, U and Ma, where it balances the Tridoshas. We have seen the patients who are following Ayurveda along with taking the purificatory therapy like Vamana and Virechana, then going for Basti along with the Panchakarma. Then the patients following the yoga therapy and especially the pranayama and dhyana and along taking the Rasa Chikitsa. We have practically seen Gandhaka Rasayana worked wonderful result. And when we were sitting in OPD along with Prajapati sir, Guruji was working in Jamnagar now. From there he went to All India Institute. Now sir has become Vice Chancellor in Jodhpur University. So when we were sitting, we got a Sora lotion from Jark Pharmacy. It is a local Gujarat pharmacy where it has been given as contents. It has given as Parada dissolved in water. So then we come to how they have done this. When Guruji ordered us, we are doing PhD in Jamnagar, they ordered us surges. So we got this reference in Rasa Tarangini. It is nothing but Rasa Karpura Drava, where it is 0.001% concentration, where Rasa Karpura is dissolved in water, and that is used as application on this psoriasis. And even that can be Rasa Karpura in smaller dose, minute dose, up to 2 mg can be given along with Guda for internal use. Especially it is followed in Andhra and all those. It is given along with Guda, and we got the reference of that Rasa Karpura dissolved in water in this Rasa Tarangini reference, where that project was taken by Dr. Neki Mehta, and she done the toxicity study and also worked on psoriasis. We got a wonderful result on that, sir. So Rasa Karpura Drava also worked on psoriasis very well. And these are few of the practical experiences which I personally shared with my Guruji Prajapati sir while working with him in Jamnagar. So it is being a psychosomatic, if Panchakarma therapy along with medicines, especially Rasaushadhis and yoga play a very, very important role. So holistic approach is necessary for treating these types of diseases, sir. These are my views regarding my experience.
Excellent, Dr. Pramodji, excellent. This is the need of the era, that senior expert faculties should share their practical experiences. Great, great. Now I would like Dr. Ajay ji, are you ready?
Pawan Sharma ji, can I share few slides if I can?
Sure, 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 sir, sure.
It is visible. Sharma ji, it is visible.
Yes, yes. You can go for slides also.
So I will show you some photograph. You know there are 5 types of psoriasis: erythrodermic, Gutte psoriasis, scalp psoriasis, plaque psoriasis, pustular psoriasis, and 42% of the people are suffering from psoriatic arthritis. So this is Rhytia tinctoria. We collect the plant, clean it, wash it, then we make small pieces, add in a coconut oil, equal 1 liter coconut oil, 1 kg this plant for 5 days. Then after that we squeeze it and ask the patient to apply this coconut or that oil. After that we use this earthworm soil paper. This is earthworm soil, freely available everywhere in our place more. Before applying, we apply heat on that earthworm soil. Then with the autoclave, we apply on affected area. So like this way, we apply in affected area. After using, you see the benefits of the patient. These are the before and after application of the oil and this paper. You see the improvement by using this therapy. See the beauty of this therapy. Again, you see the beauty of this therapy. Though we cannot cure 100%, but we give relief to the patient. Mainly earthworm soil. And that earthworm soil collaborative work is going on along with Karachi University, ICCBS, International Center for Chemical and Biological Sciences at Karachi University. So what are the main ingredient or what about the chemicals are there at that paper? You see the beauty of using that paper and oil. That lady had psoriasis. After giving our treatment, she completely cured, now married and have 1 children also. So this is treatment of Ayurveda, and he is an eye surgeon. So he said that he had this skin problem from long time back by giving our treatment at Ayurvedic College. Improvement was there. So, okay. Thank you, Pawanji.
Thank you. Thank you very much, sir, for your kind blessings.
Okay, sir.
Now I would like to request again Dr. Ajay Paul. Hope you are ready. Dr. Ajay ji, yes. Welcome.
Yes. Okay, we'll. Okay, if there is hello, sir.
Yes,
sir,
please.
they are able to visible, sir.
No.
Sir, whether is able to visible, screen is not visible, sir.
नहीं, आपकी स्क्रीन विजिबल नहीं है, आपने शेयर नहीं की है अभी. आप डॉक्टर देवी को दे देते तो वो कर देती देवी.
No, I have sent that actually.
I didn't receive Ajay sir.
देवी जी आपके पास पहुंच गया वो पावर पॉइंट. Have it reached? Dr. Devi?
Sir,
Am I audible
no,
to
sir.
you?
I didn't receive, sir. I didn't receive, sir. Either he can WhatsApp or mail. I've sent actually mail, but
Yes,
I didn't
yes.
receive anything.
Oh. So in the meantime, I would like to request
time,
Dr.
sir.
Gulamuddin Sofi sir. Dr. Gulamuddin Sofi ji. Because pause is not better for the seminar. Please arrange in the meantime. डॉक्टर देवी को दे दीजिए तो डॉक्टर देवी अपने आप प्रेजेंट कर देंगे.
Yes, sir. Yes, sir.
Dr. Gulamuddin Sofi ji is head of the department of Unani Pharmacology in National Institute of Unani Medicine, Bangalore. Welcome.
Sir, is now visible, sir?
It is visible.
Okay, sir. Okay, sir. Sorry for the delay, sir. Actually, was a little unaware about this to take out how to take the screenshot. That's what I would taken little time, sir. Is correctly visible, no, sir? Now. Hello.
Yes, your mobile screen is visible. Yes,
okay.
Yes, it's now.
No, perception is visible. No.
Excellent.
Okay. Thank
Excellent.
you, sir. Thank you, sir. Thank you, sir. Thank you for giving opportunity to present in the Psoriatic Day. Myself, Dr. Ajay Paul from the Department of Kajivalsa, Ayurveda College, Coimbatore. Thank you for all those who are came for hearing this. We all know that it is Psoriatic Day. So I am going to present on psoriasis and Ayurvedic remedies. So psoriasis, all know, it is already presented, Devi Doctor and Shuklam sir, and others are presented on that one. Psoriasis is non-contagious, it's not contagious one, and this is chronic autoimmune skin disease and is inflammatory hyperplastic disorder. Characterized features is erythema. There will be an erythema or the present in the every type in the starting stage of psoriasis. So will be elevated scaly plaques will be present. So how to diagnose? The diagnosis will be based on the appearance, distribution, history of lesion, and family history. So already Devi Madam and others will be taught about the discussed about the types of psoriasis and how this one will be seen. I am just giving a small hint on that one. Based on appearance, say there will be gut-type psoriasis, where there will be raindrop appearance. There will be small round appearance will be present, and it is especially in children. And in there will be a history of a streptococcal infection, throat infection prior to a gut-A type of psoriasis. Moving to an napkin type of psoriasis, where there will be children are most suffered. The napkin, there will be napkin rashes will be there after this, and there will be producing a so napkin areas, that appearance will be seen in napkin type of psoriasis. And then will be flexure, there will be, or inverse. That type there will be mostly seen in the areas where they having no not much flexor layer, means that areas will be in the below the axilla region, below the groin region, like the sweating areas will be along with the flexural type of psoriasis. And based on one more is ruboid type. Ruboid type means will be ruboid appearance will be there in psoriasis, especially that will be seen in the hands, and especially in the tip of hands will be these type of psoriasis. And based on distribution will be maybe it's smallly sometimes there will be plague psoriasis. The plague psoriasis will be distributed all over the body, including flexural and dorsal every aspect, but flexural aspect will be mostly seen. But palmoplantar or psoriasis, the distribution only in the palmoplantar and flexural or inverse already told about inverse part. So these are the based on distribution. Then about history. The history of psoriasis, we all know that there will be the lesion should be take the family history, both family history in the sense that there will be little, the 5% or 10% cases of psoriasis, they will be having positive family history. History of the lesion in the sense we should be, there will be a pregnant type, or there will be cortisol injection. So there will be some history should be there. Say psychological issues, say psychosomatic disorders, they have been consuming severely of lithium or psychosomatic drugs, there are chances of getting psoriasis. Or there have been cortisol injections for infection, and there will be cortisol or hydrocortisol, there will be severely they are injected, there also will be having chances of getting psoriasis. And other in the pregnancy also, there are that will be because there will be cortisol level will be higher in the time of pregnancy. And so these are the other one more thing already told, gut-A psoriasis due to a streptococcal infection prior to gut-A one. So there will be history should be there, that should be also ruled out while diagnosing the psoriasis. Moving to, if you are not by appearance, by distribution, by history, we are not diagnosed, we will go to the biopsy. Then biopsy, histopathological biopsy, that will deal next slide. And by clinical signs, already Madam told about Van sign, Ortswit sign, and pancreatitis. While scraping there will be tiny blood comes out, that is Ortswit sign. Then will be wax candle, means there will be greasy appearance can be ruled out from the lesion. Then these signs also positive in the case of a psoriasis. So when if you are not well about the lesions, we go for histopathological test. So histopathological test, there will be parakeratinosis or retention of nuclei of striatum corneum. You should know that there will be epidermal layer will be having 5 layers, and the above one is striatum corneum, where there is no nuclei present. So when this lesion or the psoriatic condition, the nucleus will be present in the striatum corneum. That is known as parakeratinosis. Acanthosis is nothing but thickening of striatum spinosum. Striatum spinosum, it is horny layer, or spinosum plus along with the basal layer, it's horny layer. there will be thickening because from the germinal layer, will be continuous production of the keratinocytes. That's why there will be thickening of a spinosum. And there will be absence of a stratum granulosum. And there is neutrophils present in the stratum spinosum. That is known as spongiform pustules of Golgi. And neutrophils stratum corneum also. So that is known as microabscess. So as already Shukla sir also explained this about pustules and abscess. So these are staging where be occurring of psoriasis. Then there will be suprapapillary thinning of epidermis. Above the dermal layer, there will be papillary, or the dermal layer, means epidermal last layer, dermal layer will be thinned. For differential diagnosis, as we already discussed the types, the patch or plaque psoriasis, palmoplantar psoriasis, gutted, flexure or inverse, erythrodermic. So usually there will be patch or plaque psoriasis is everywhere. So the most common one is this type of psoriasis, where we should do scrape test, not scratch test, is a spelling mistake actually. Scrape test, you have to scrape that area. You want to differentiate between fungal growth, you scrape that one, and potassium hydrochloride, you mix that one and you use it with the microscope. You can differentiate the fungal with the plaque, because it's a common, both in the condition that there will be rajogustam or the scaly appearance will be seen. Then there will be eczema in the last stage, eczemic the atopic dermatitis stage. In last stage, there is chances of a scaly appearance or lichenification appearance. So that should be also, it's a triad that should be also differentiated. Then seborrheic dermatitis and Bowman's disease also differentiated by Spitz sign. Then cutaneous T-cell lymphoma, that's also differentiated from plaque psoriasis. Next is palmoplantar or palmar regions or plantar region. These psoriasis should be differentiated by tinea and contact dermatitis. Guttate psoriasis should be differentiated from Psoriasis rosa because it's very similar. It is also occurred in both, in the guttate also, and Psoriasis rosa also occurs in children. But the area will be more in area will be more in backside, and the backside where the psoriatic lesions like guttate will be droplet, but in rosea, the Psoriasis rosea is like a whitish, little whitish appearance will be there. So that should be a differentiated mark other than the main clinical features. Then secondary syphilis also should be differentiated by our rule out from the test. Then flexure, that will be tinea and eczema. Seborrheic dermatitis also should be differentiated. Then erythrodermic, all area will be affected. That should be differentiated by Psoriasis rubra and Leach's manus. With Psoriasis rubra, because it is occurred in the all area like the erythrodermic type of psoriasis. So yeah, that should be by Auschwitz sign and sandy grease appearance. That should be our differential diagnosis from these conditions. Moving to next is how we treat, how we will diagnose that one with the Ayurvedic way. Commonly, we will diagnose with the Sitma Gustam because it's Vata Kapha predominant, white, coppery, red appearance, and the sloga goes like Sweda Tamram Tanu Cha Rajogristam Vimuchadi Alapu Pushpavarnam Tat Sitmam Prayena Chaurasi. So Sweda, the color is Sweda, whitish. Tamram, there will be erythema or redness will be present, and Rajogristam. Raja means it refers to scaly or the appearance will be there, and Alabu Pushpa. Alabu Pushpa is nothing but whitish color. So, and this is from Charaga. Moving to Ashtanga, also same. Sitmam Ruksham Bahisnigdam Andagrishta Rajo Sleshna Samsparsham Tanushveda Tamram Daudiga Pushpam. Means both Alabu and Daudigam is similar. But Ruksha will be more highlighted in Ashtanga Hridaya. Moving to the Alaba Pushpa is whitish color. You can see similarity. There will be Pushpa color and this one is most. So it is non-infectious chronic inflammatory disease. So there will be erythematous plaques when we can compare with the Rajogrishtam and Parusha, Aruna, Vishirna, Behi, Anda, Snigdha, Shukla, Rektavas. Shuklam and Rektam both will be there. Whitishness will be there and there will be erythema will be present. So likewise, this comparison will be also for the Sitma Gushta. Then we can compare one more disease is Charmakyam. Charmakyam, Bahalam, Asti Charmavad. So elephantial psoriasis is a one type of psoriasis, is a rare condition. Then there will be chances of getting similar to Asti Charmavad. Then our Vaibhadya Gushtam in Shudra Gushtam, Vaipadikam Panipada Spudanam Tivra Vedana. So our plantar psoriasis or palmar plantar psoriasis is thickened skin that is painful fissure. So the Tivra Vedanam obviously will be there by Vaibhadya Gushtam. So the after fleshy areas of feet, pustules after 7 to 14 days, there will be brown scale and that is very painful. Then one more comparison we can give is Ega Gushtam. Already told that Asvedam Mahavastu Yats Masya Sagalopamam. So the dry and scales, thickened and mild itch. So the scaling will be highlighted here. Then Dadru, one more condition as told by Acharya where Charaga highlighted in Shudra Gushta. Sa Kandu Raga Pidigam. So there will be Kandu and Ragam and Pidigam. So commonly Gattate and pustular type, there will be raindrop appearance and this will be present in every place. So that is type we can compare with the Dadru Gushtam. Next is our Mandala Gushtam. Mandala Gushtam, Snigdani, Guruni, Asvedani, Slakshna Paryandani, Shukla Rektabasani, Shuklam and Rektabasanam, and Parimandalani. So these line Bahula Shukla Pichila Sravi, Bahu Kleda Kandu Krimi. So likewise, the Lakshanas are also we can correlate with the Mandala Gushtam. But we already taught Sitmam, Kidibam, Ega Gushtam, all we cannot diagnose which one will be proper. So we'll go for the Dadu Ansara. Though when the Susruta highlighted Dadu Ansara Lakshanas, where Twaja or Rasagada, there will be Sparsahani, Swedanatvam, Ishyat Kandu Jayade, Vaivarnyam, Rukshavasam, Pushtam Twaji Samaste. While in the Shonidam, Tukswabaha, Romaharsha, Svedasya Vipravartanam, Kandu Vipuyam. So by understanding these two, Rasa and Rekta, Dadus, we can give the treatment. And moving Mamsa also, Meda also, there will be deeper seated, so there will be Bahulya Makram, Pidiga, Toda Spudana Stiratvam. There will be, if you have the lesions go deeper, Mamsa Dadu, these Lakshanas will be present. So then Meda, they are highlighted Gatranam Vedanam. They highlighted on that aspect. So they and the Sadhya Sadhya of Dadu Gadaja Kushta told by Susruta, Sadhyam Tukrekta Mamsastam Vada Sleshmadigam. Medasidom the Jamyapyam, Varjain Majastim Samsardam. So Tukrekta Mamsam mostly Sadhyam Vada Sleshma. It continues to the Meda, it will be Apya. So I am going to little modern treatment, what they do. They are doing with what? First they will do with the corticosteroid therapy like hydrocortisone internally or externally as a tablet or a injection form, then they may be using the coal tar application, and there will be dithanol based therapy extracted from Arabo. It is outside India. One plant is from there. We use that one for. They use that one for application. Then puwa therapy. Puwa is nothing but our bakuji extract. That is soralin. Soralin, methyl oxysoralin or trimethyl oxyltaranin, and along with that UVA, ultraviolet A radiation, they are give for the modern therapy. Or kuwa therapy, kaolin, that is from ami variety of seeds. From there, along with the ultraviolet kuwa, we UVA for ultraviolet A brand. Methotrexate, it is the commonest way of treatment of psoriasis. That is folic acid antagonist. So the cells will not be developed. So that is there will be liver toxicity and everything will be the side effect for methotrexate. So retinoids are like vitamin A, alcohol extract also they will use for the treatment for. So what we can do, we will do based on clinical approach. We will first of all devavasya chikitsa, but because the manasiga avastha or the psychotic effect will be very much will be there in the case of a psoriasis. So that devavasya chikitsa, but in what Ashtanga Hridaya says, was last line is Shiva and Subramanya Archana for the Kushta. So ask the patient to go the temples or church or mosque, whichever is suitable for them, so that the psychotic level or stress level can be reduced. And next, along with that, yama, pranayama. So yama and pranayama gives the pranic approach, and jnana all will comes under devavasya. All we can do with the devavasya and also comes in sattva chikitsa. But next two will go for yuktiva chikitsa, where there will be dosha pratyayana chikitsa, dusya chikitsa, avasthanusara chikitsa, vyadhi pratyayana chikitsa, and rasayana chikitsa. Dosha pratyayana chikitsa, there will be mostly the sigma kushtam all are comes under vata kaphaja. But the pitta involvement also is there. That's why Acharya told tridosham is the main cause for all skin diseases or kushta type, because the pitta, the erythema will be present from starting stage to recurrent stage. So the pitta anubandham will be there, either pitta kapha or vada pitta along with the pitta anubandham. So our line of treatment should be based pitta anubandha vada kaphajam. The dushas most are rasa and rakta. As we rakta and rasa, dhatu ashraya, we can say the lakshanas are sparshaha, asvedam, vaivarnyam, toksvaparom, harsham, all are similar. So raksa, rakta, dushas. Avasthanusara means amatvam, whether it is there or not, whether nirama avastha, that we check that one. Nava and Jirna, because the clinical condition of psoriasis is very chronic, so that the patient relapsing and recurrence of the disease very much common. So Jirna and Nava should be highlighted. Vyadhi pratyayana chikitsa and rasayana chikitsa. Last but not the least, sattva chikitsa should be also highlighted. So here I am highlighting the krimi chikitsa, because the kushta chikitsa and krimi chikitsa are both side by side we can go. So nidana parivarjanam, apagarshanam, and prakriti vigadhanam. Nidana parivarjanam. So what we go? Nidana, what are the nidana? There is a stress. So continuous stress, psychotic stress, or the job stress, all are the positive factor that should be eliminated. All we know about smoking and alcohol, the additives, that also should be eliminated. And the trauma, whether it is a physical trauma, whether it is a mental trauma, that is also taken care for the Nidana Parivarjana. Drugs like antimalarial drugs, non-steroid anti-inflammatory drugs, and our psychotic drugs like lithium and all are causing the psoriasis. So that also parivarjana to the Nidana. The infections like viral, obviously viral infection and the bacterial infection like streptococcal infection, that also should be parivarjana to Nindana. Then apakarshana or shodhana. Kushta disease is due to dosha bahulya. So even it is durvirikta and durvanda, we should give the shodhana. That's why pakshad or chardanam, masad sramsanam, vatsadvi, rakta Sravanam, Nasyam, Triratra. They highlighted the repeated Shodhana because Durvikto, Durvando, Kushtam is needed for repeated Shodhana because it's dosha bahulyata. So, moving to the Kushta of Abakarshana Jigilsa, they told Stigdasya Shodhanam Yojim, Visarpam Yadahuni. What Visarpa line of treatment, what they told in Visarpa, we should adopt. So what Visarpa they told, Prachardanam, Chardana should be done, Visarpaknam. So the Visarpa line should be adopted in Kushta Chikitsa also. So Chardanam or the Vamanam should be done in Visarpa, and the Virajana should be adopted with St Indraeva and Padola Pippali Nimba Pallavam. So I mostly I will be with started with the Vamana. That will be give wonderful result while giving the Vamana. Starting stage itself will be due to dosha bahulyata will be while giving the Vamana itself will give the results. Mostly the drugs will be using like Madana Pippali Vacha Ishti, that will know. But Nimba Kashaya is I add compared to my Estimudu Fanda, milk and everything will add, but Nimba Kashaya, Nimba Patra handful will take, 3 handful I will take, and 10 liter of water reduced to 5 liter. That also I will use for the Vamana. For Virajana purpose, we can use like Trayamana Rasam, means our Brahmi Rasam, Draksha Rasam with Trifala, or Ruksha Virajana, like either with the Trivirt or milk or Grida, or Avibhatti Churna, or Manibhadra Churna. Likewise, the Virajana can be adopted. Then before this one, we should give Snehabana, either Vijarana Sneha or Achabana Sneha. Common Snehabana are adopted are Tiktakam Gridam. That is for Pittaharatvam. So when Pittanubandham is there, say pustular type of psoriasis, Gattai type of psoriasis, there will be erythema in every time. That time we can use the Tiktakam or Tiktaka Gridam. Then Mahatiktakam, there will be Amalaki Surasam is more. So the Rasayana effect is added there. Arangoda Mahatiktakam is Anubhuta Yogam, where Arangoda added to the Mahatiktakam Kashayam elements, Gridam form. So that will be ideal for Sithma, where there will be chronic plaque psoriasis. Arangoda Moolagridam, there will be itching will be more, then we can use the Kafaharatam, we can adopt for Arangoda Moola. Vajragam, there will be Tiktarasa Pradhanam and Mahavajragam also. So in this condition, there will be Pitta associated psoriasis, we can adopt for Mahavajragam and Vajragam. Panchatikta Gridam, that will be Gugulidittam only mostly. Gugulidittakam, Gugulu is a Shamana Drivya. So Gugulidittakam, we can modify it to Panchatikta Gridam so that Gugulu can be adopted, because Nimba Amrata Virsha Padola Adi Kashayam is the main Kashayam for Panchatikta and Gugulidittakam. But Gugulu can be ruled out to make it as otherwise Gugulu act as a specifying a Shamana Drivya. So we need a Dosha Kleshana, so we can add a Panchatikta Gridam. And for psychotic problems is also there for this condition, we can add with Kalyana. So this drug of choice of Tiktakam, Mahatiktakam, Arangodadi, everything should be done with the proper either Vijarana or Achapana with the higher dosage. If a higher dosage they do means with the Snehabana itself, it will give the reduction of the lesions. Especially with Panchatikta Gridam or Tikta Gridam will be giving the wonderful result. And with the Murchita Tiladailam will not prefer, because is that much lesions will be there. So while giving the some Murchita Tiladailam or Murchita Gridam, it will aggravate the condition. That's why the processed one will be used. Then Svedana, commonly is not that much use, but Nadi Sveda or Avikiri. Avikiri means steaming kiri with the Danyamalam. Steam kiri contains Kulatta, Kola, Yeva, Sadahua, Randavijam, and Metiga, Kusta Devadaru, Rasna, and Haridra. And this is very useful in the condition of where it will be pustular and guttate type. And Eladi Jurna Avikiri will be useful psoriatic arthritis, will be painful because we are having pain, but there will be lesions in the joints. That time Eladi Churna Vikiri will be mostly useful. Kadikiri, there will be Danyamla Kiri, not steaming while pressing on Danyamlam, we can do the Kiri, that also useful for Svedana. Then Patra Pontale Svedam, that is very ruksha, like plague psoriasis, with Nimbapatram, Haridram, Metiga, and Nimbadailam will use for Svedana. Then Prakriti Vigadana Chikitsa. So in that, here one more add, we can add with Vasti, but commonly Vasti is not preferable treatment for Kushta, but some Panchadiktagam Kashai Vasti, Manjishtadik Shira Vasti also can be used with having chronic condition. Then Prakriti Vigadanam is nothing but Shamana treatment. So the Shamana line of treatment, what we adopt from Vishama Joradhyara. So what they told, Kalinga Padola se Patra Kaduroni for Resagatajam. Padola Sariva Musta Padagadurohini for Rektajam. So Resa Rekta Dushyas are more dominant in the case of a psoriasis. So we will prefer Shodhananga Kashayam like Padola Kaduroniadi. So they are the most are similar to our Kalinga Padola se Patra Kaduroni. So the drugs are very similar. Then will be Chandana and other thing will be added to the Kadruhandi, but others are similar. Padola Muladi, that is also Padola Vishala drugs add a little bit similar to the Resa and Rekta Pajanam. So these Resarekta Pajanartham, we can give this Kashayam and it will give Shodhana property also. Next commonly used Samana Kashayams are Shonidamratam Kashayam. Here having Rektaja more, then we can use Shonidamrita. Only 3 contents are there. Then Nishotamadi Kashayam is very useful. And Manjishtadi Kashayam, Pitta Kashayam, and Nimbadi Kashayam. If you are having guttate or Pittanubandha is more, then we can use Manjishtadi, Tiktagam, or Nimbadi. Kafanubandham, we can go Ugulitagam or the Gidrarishtadi Kashayam. Then Vada, Pittam, Mahatiktam Kashayam, or Vajrang Kashayam. They both are pustular type, we can use Mahatiktagam. Then Mahamanjishtadi, if you are given use psoriatic arthritis. Then some of the Samana, other Samana like Guligas. Vilvadi Guliga is common Pragaranam. Then Dushi Vishari Gula, because the Visha concept is also should be there for psoriatic conditions. So when having tiny Dushi Visha concept, because there will be accumulation of a drugs, accumulation of a cortisol, accumulation of a calcium, all can be causes psoriasis. So the Dushi Visharam should be done. So that Guliga is useful. Manasamitram Guliga, usually for psychological problem. Resa Pajanartham. So that will be available in the Pune and all. Resa Pajana Guliga, Tekta Pajana Guliga. Then Visha Vilvadi is a combination from Kerala. So it is nothing but adding Vilvadi to Pada, Ishwara Mula, and Nili Mula. So Visha Vilvadi is very useful for acute, like pustula or guttate psoriasis. Then Taruna Bhaskara Guliga is also useful in the case of acute conditions. So acute condition is like pustular and guttate. There will be very severe. Sometimes the modern treatment, they will go for a very severe dosage of a steroid. So that time when we can adopt with this Vishvilvadi and Tarunamaskaram and other drugs like Gandhagarasayanam, all will give a result on that one. Churnam. Churnam Gugulivanjala Churnam for Kafanubandham. Nimbadi Padoladi for Pittanubandham. Rajanyadi is Kafavada Anubandham. Rajanyadi Churnam along with Avibhatti Churnam is very useful for Kafa Vada Anubandha type of psoriasis. And Hydragandam also can be Asava only Gomutra because there will be need Lukshana. We can give Chitragasavam like Gomutra is a content, Mulagasavam, Nimbasavam, Kedriaristam, and Gomutrasavam also. And Kafapitta, Nimbamradasavam, the Gugulutam is the content of that one. And Lodrasavam also can be given. Rasa medicines like Gandhaga because Gandhaga Ledagam is told there. So the Gandharasana is highlighted, Tamra Basmam, because copper content will be having good impact on the for the skin proliferation. So Tamra Basmam is used. And Taga Basmam, Rasasinduram, Samanikyam is commonly used for Kafabandham. Lehyam like Kalyanaga Gulam, Madhusnuhi, Chariya Madhusnuhi Rasayanam, Ugulu Tiktam Madhusnuhi Rasayanam, Manibandra Lehyam. These are commonly used Lehyam for condition. Dara. The common Dara we use, one is Kashaya Dara and Takra Dara. Kashaya Dara as Avada, Avagaham or Dara. Like Manjishtadi Kashayam, Ulichadi Kashayam, Arangodadi Kashayam. So these will reduce the scaling and will be recurrence can be reduced. As a Takradara, whole body and the head also. This can be adopted with Arangodadi Kashayam, Sushma Churnam, 60 gram and 3 liter water, 3 liter milk, curd will be making, and after next day the butter will be turn out from this one. And that Takra will be using full body and in the scalp region also. But you should be careful because the Ruksha Guna will be high if you Takra use continuously. So the days will be, you should be very careful on the days. So limited days, if you having Ruksha is more, you can limit the days. Without scalp, 14 days we can continue because scalp type psoriasis, scalp is also will be a psoriasis, we can reduce the dosage. Arangodadi Churna also for bathing we can use. Labam, as already told, Siddhartha Churnam we can as labam with the takram. Nimba Hridradi also we can use with the takram because it gives an very continuous is elephantiasis psoriasis or lichen planus. We can, if we give the this Siddhartha Snanaj or Nimbadi as a labam, as a Snana also, by Kudkarshan also will give the result. Abhyangam already told, Ayapala or Brahatandabala or Dandabala Keratailam is very commonly everywhere we using that one. But it may be causing irritation because it gives like Takra Dara, it also Yuksha that will be irritated to that patient if you give continuously for a long time. The 777 also same content only. Rea tinctora is the main content of this Ayapala, but continuous usage this will be problematic. So we can mix Jivantyadi Yamagam as told in Kushta Prakarana. So that is gives Yamaga means having two Grida forms along with Dandapala or Brahatandapala or Ayapala will be useful that one. Or if you are having newly formed or Pittanubandha or Gattate or flexural type, you can use Tiktagam, Shadadauda Grudam or Durvadi for Abhyanga. Erythailam is one drug that erythailam, it is nothing but just burning out the drugs and making the thaila. It is preparations which is a tradition in the Kerala. This yoga is told in Prayoga Samachaya in Mandali Visha Yoga. So that is useful. Like in Shadajakasa, Devadaru Gashtra Pradipta, like Thaila, like that, like Devadara, there will be other drugs which are used as erythailam. There are different type of erythailam available, so that also used for acute conditions. And Vajraga Thailam and Ushna, so that Kafanubandham condition we can use. Mahavajragam also similar. Other treatment like Nasya, as already discussed by Devi Madam, Nasya is also very useful. But we can start with Anudaila and all. It will give a psychosomatic physical defect means the level will be reduced in the case giving the nasya. You may be wondering the Shashtikshali Pindasveda giving very much useful because the lesion is very much scaly and there will be very rukshatvam will be there. Shali Pindasvedam instead of Bela, Manjishtadi Kashayam will use, then it gives an good result compared to the common other like Abhyanga and all. So rather than Pindasvedam, rather than the Bashpasvedam, that we Shatikashala Pindasvedam lastly as a Rasayana also we can use. Then moving to the Rasayana, common used Rasayanas are Ballada Rasayana, Madhusnehi, Cheriya Madhusnehi Rasayanam, Tuvaraga Rasayanam. The Ballada Rasayanam is practiced in some areas, but I am not practiced that one. Madhusnehi, I will used that one is used to give in morning. That is all told in the reference also Pradam Pibed. And Tuvaraga Rasayanam, that they told Chaturtha Bandhadraga means there will be 4 days gap, 4 Bhakta means 4 Annagala gap should be there. So commonly we can use 15 to 10 or 10 ml in the morning time after Shodhana, after Samsarjana Krama. You can start with the Tuvaraga Daila, 10 to 15 ml morning, and 2 days rest should be there. That the resting time or Chaturtha Bhaktandra, that time, then Asneha Levana Yavagu should be given. For Balavan patient, 1 day gap is enough, but Abalavan patient, 2 day gap should be. So this Tavaraga Taila gives as a Rasayana after Shodhana, after all Shodhana, it will give relapsing will be reduced because already 1 year, 2 year, 5 year gap there will be relapse should be there. So that can be reduced in the case of Tuvaraga. Moving to Pathyavatya, Abatya, pulses except green gram, gluten. They have been modernly they are selling gluten free. That gluten sensitivity is there. So it is mostly the Western cultures. They are Western areas. Their gluten sensitivity is more compared to Asian area. But other than the patient, we should say about gluten rich. Avoid the gluten rich diet like wheat product, barley, malt beverage like beer and all. You should be avoid. And pasta, they will be regular with the pasta, noodles, so that you should be very careful and you should say about these should be avoided. And sauces like tomato sauce and all, ketchups and all, you should be the patient. We should tell the patient about to avoid. And other apathy is red meat and eggs. For polyunsaturated fatty acid like arachidonic acid can be possible to give the psoriasis. So avoid these. So commonly the kushta we will ask the patient to avoid that. And milk and milky product also will also say to avoid. Then processed food. Processed in the sense all processed like sugar processed, salt processed, fat processed. So that all gives high caloric. When having high caloric also can cause psoriasis. So kindly ask the patient to avoid these things. And nightshades, Solanaceae family, especially our Indian used nightshades or Solanaceae family are potato, brinjal or eggplant, capsicum, tomato. So these one ask the patient to avoid. Then sour fruits like pineapple, grape, lemon. Though these are all usually say to the patient to avoid. Along with this, Viruddhada is very much. So Viruddhada in the sense, Viruddhada nowadays we can exclude, say ice cream, they are consuming ice cream with blueberry, like a grape they are consuming. So these are lavana, means milk and the sour things. So these are they are consuming that we should dig out and we should tell the patient to avoid these abatya. Moving to patya, vegan diet is highlighted in psoriasis, and yava we can use an anna prepared of kashaya like vishavega avastha. In Ashtanga they highlighted koshandigyadi yavagu. So that kashaya and yavagu we can made of kashaya. So that yavagu we can consume in visha we can reduce. So here the vishamsha is there. So to prepare this anna will be useful. Sanmat they highlighted to 10 to 15 minutes. Use of coconut oil, cotton dress there should be because any other dress will be having chances of irritate and more will be or itchy will be more. Then the other diet like paleo diet, Mediterranean diet. Paleo diet is also like whole food, no processed food. Like that one is highlighted in Western. That gives a good result and by research. And Mediterranean diet and healthy fat diet. So these are diet they have followed. But on our following, we can follow like a Viruddha. We should be very taken care, and we should first we should write down everything, and we should exclude the Viruddha ahara from our patients' apatya. Some of the yoga poses, like obviously for Sattva Chikitsa, asana, pranayama can be used. These are some cases where first case, this one this is a recurrence or relapsed condition. After 6 years, came to me. Actually, time it was I given with Vamana and Shamana Aushadas. Afterwards, again relapsed after 6 years. So again, same conditions, same area with scaly appearance was there. I started with Padavalogadonyadi. You can change within 10-20 days. The scales and the erythema is got reduced. So this from left side it is before treatment, right side is after treatment. So that is reduced after 15-20 minutes. Now I need again one more shodhana because the patient is not willing to take continuous. I given Mamana in 6 years after is not willing to take afterwards. So now again I can convinced him to take one more Mamana and Virajana and all. So when repeated Shodhana is necessary for this type of any type of psoriasis. So this is also one more case. He can give with this one I given with Tikta because Pani Padaspudanam that was there is a like both in the erythrodermic only. Pani Padaspudanam is also there. That is palmo plantar areas are mostly affected. So where in the below picture, so there I only used Tiktagam because there will be severe pain also associated there, and above one seborrheic type, not seborrheic type, erythrodermic type. So where I used Arangodad. So these Gridam form only I given. We can give some result to the patient, but the relapsing or recurrence will be there in the patients. Okay. Hello. So
Yes.
by this I am concluding my session. Thank you for giving the opportunity to present here. Thank you all the those who are behind the area, and thank you for Shukla sir and our PK Rao sir. He given opportunity to present here. Thank you. Any doubt can ask me.
Thank you very much. Thank you very much, Dr. Ajay. Very nicely explained. Please stop sharing. Now I would like to request our last speaker with a request for focus only on practical experiences. Please, Dr. K.C. Priyadarshini Gunratne from Sri Lanka. Welcome, madam. Welcome.
Sir, good evening. Sir, can I share now?
Yes, yes.
Sir.
As time is over, I would like to
Yes.
request you to shortlist the slides with practical experiences only. It is my
Yes, sir.
humble request.
Yes, sir.
Okay.
Sir, you are only moving that my slides, no? Then go ahead, sir. Go ahead, sir.
It is better to move from your side.
Oh, wait, sir. Wait, sir. So it's taking time. So just can you show my slides? It's taking time, sir. Sir, can you share my slides, sir? It's taking time.
Already shared, madam. Please see, already shared.
So I can't see it.
Agnihotri ji.
Yes, sir. It is already there, madam. You see
Yes,
the.
sir. Yes, yes,
Yeah,
yes,
yeah,
yes,
yeah,
sir.
yeah.
Yes.
It's very clear.
Yes. Okay, sir. Actually, good evening. Just I want to show one case presentation. Sir, just next slide, please, sir. One girl came around 26 years old in 2012. At that time, she was around 26 years old, but she is suffering that psoriasis since 19 years. At that time, she had only mild itching, and she was not having any family history or any other problems. Then I just started with Agnidipana, then Namapachana, and then I started Panchakarma treatments. So next one, Panchakarma treatments. At that time, I started with Achapana treatments for 7 days and Vamana, then Samsajjana Krama, then again I gave a 3 days gap. Then I have started again Achapana and that Virechana Karma followed by Samsajjana Krama. Then I have done Basti Karma for 16 days along with Sthanika Chikitsa and following Patya Patya. So just I want to show next one. See the progress of the case. So next one. So next one. See, before the Achapana and Vamana Karma, this is the case. We can see she had that all lesions all over her body. But after Achapana and Vamana, before the Virechana Karma, so next one, see, this is the result I have gained with her body. Then after Achapana and Virechana, you can see with the next slide, what are the changes of her body. Yes, this is the changes of the body. Next, I have started that Basti Karma at that time. So next one, yes, this is the before condition. After the Basti Karma for 16 days, we can see the changes of her body. This all happened 2012, September and October only. Soon after the treatments, she became mostly in normal way. Then next 2013 January, she sent her photos for me. Next one, sir. 2013, next one, January. Yes, this is the after Basti Karma. Then 2013 January, she sent some pictures while she was coming first time to me. And at that time, she was covered the whole body. But after the treatment, she came like this much exposes to the society. But 2014, I had to repeat the same protocol. as well as 2016 also I have to do the same protocol because of the recurrence. This is the 2020. Now I have to show the last one, 2021. How was she? I have to show this because of this Panchakarma treatments. And again, I have to started only Shamana and Tarpana, a few treatments for maintaining her condition. Now she is not taking any medications. Now she is totally okay. That's all in my short presentation. Thank you very much. Thank you, sir.
Excellent, madam. Excellent. It was too short. Excellent. Really. Naman to you. Agnihotri, sir. Excellent, madam.
Really, madam, you have just opened our eyes. That could Panchakarma, especially the Vastikarma, is so fruitful and beneficial in such an advanced case of psoriasis, which has been clinically presented and day by day, progress and improvement is shown. You have not treated that girl of 26 years physically, but you gave so soothing effect to her mental status that now she is clearly away from the agony that she is suffering from, or she was suffering from any of the such a incurable type disease, which was making herself so shy to come in the society. Great work, excellent. You are next to God for her. Thank you so much. Thank you so much, madam. Thank you.
Thank
She
you,
got
sir.
married last year.
Yeah?
She got married last year, sir.
Wow, it's a you have given a great boon to her. I can say only this much, that you have rectified and modified her life completely. Yes, madam.
Yes, sir. Thank you, sir.
Thank you.
Thank you, sir. Thank you. Thank you very much. If from audience, Dr. Leena or Dr. Neelakshi would like to say anything, or Dr. C.P. Sharma ji is here with us. Welcome, Dr. Sharma ji. Welcome. Dr. Parikshit, welcome. Momita ji, welcome. If anybody would like to say anything, otherwise, Dr. V.K. Agnihotri, sir, for concluding remarks.
Yes, sir.
Sharma ji.
Yes, Sharma, yes, please.
सर आई एम एक्सट्रीमली सॉरी, मैं बहुत विलंब से जुड़ा, परंतु मेरा जो एक्सपीरियंस रहा जिसमें मेरे पास सोरियोसिस के केस आए, त्वक विकारों के जो केस थे, मैडम का जो बिल्कुल क्लिनिकली एक्सप्लेनेशन, उसके लिए मैडम को बहुत बहुत धन्यवाद। मैंने जहां प्रयोग किया है, पंचकर्म के साथ आहार विहार का भी थोड़ा सा हमने विशेष प्रयोग किया था। प्रातः पेशेंट को हम पंचतिक्त घृत का पान कराते हैं, पंचतिक्त घृत, और प्रक्षालन के लिए गौमूत्र, जिससे गौमूत्र और महामंजिष्टादि का काढ़ा। इवन एक पेशेंट था जिसको अवगाह पूरा का पूरा महामंजिष्टादि के काढ़े के टब में लेटाते थे, उसको पैथिक अभिव्यक्ति ज्यादा थी। वास्तव में सोरियोसिस में कफ और वात और पित्त तीसरे नंबर पर है। तो जहां कुष्ठग्न औषधियों का आयुर्वेद में वर्णन है, उनमें गौमूत्र, खदिर कुष्ठग्ना नाम, तुवरक को भी कहा कुष्ठवैरी, तुवरक तेल बनता है उसका, पंचतिक्त घृत गुलू, और प्रातः जो काढ़े के रूप में मैंने पटोल आदि क्वाथ, प्रातः जब हम घृत पान करा रहे हैं उस समय पंचतिक्त घृत का सेवन कराया। वो पंचतिक्त घृत का अनुपान रखा हमने पटोल आदि क्वाथ, महामंजिष्टादि क्वाथ रखा भोजन के बाद, जब जो भी कुछ खाए उसके बाद महामंजिष्टादि का क्वाथ दिया। और जहां इचिंग ज्यादा हो रही है उस स्थिति में उसमें गौमूत्र प्रक्षालन और उसमें इमीडिएट महामंजिष्टादि क्वाथ और खजरारिष्ट का सेवन। तो ये छोटे मोटे अनुभव रहे हैं, बहुत ज्यादा क्लिनिकली ग्रुप में तो नहीं किया, परंतु जिस तरह से हमारी क्लिनिक में पेशेंट आते हैं उन पेशेंट्स में हमें अच्छे रिजल्ट आयुर्वेदिक चिकित्सा से मिलते हैं और मिले हैं। वह शर्त है कि हम जिस तरह से आजकल क्लिनिकली या एडवांस बेस्ड क्लिनिकल ट्रायल अपनी व्यवस्थापन बने और हम उसका एक रिकॉर्ड रखें। फिर उसके बाद हमें चाहे निम्ब तेल का प्रयोग करना हो, निम्ब पंचांग को, सरसों के तेल को संस्कारित किया जाए, तिल तेल के स्थान पर सरसों के तेल का संस्कारित किया निम्ब पंचांग से, वो है उसका भी एप्लीकेशन रहा। साथ ही जो हमारा ये करंज जिसे कहते हैं अपन, उसका तेल भी इरिटेशन की स्थिति में प्रयोग किया। तो इस तरह के छोटे छोटे अनुभव रहे। और बाकी जो हमारी इसकी चिकित्सा का सिद्धांत है, षष्ठे मासे शिरामोक्षम प्रतिमासे मासम विरेचनम प्रतिपक्षम च भवनम कुष्ठे लेपम त्रहाचरेत, वातोत्तरेषु शरपिभ्रमणम श्लेष्मोत्तरेषु कुष्ठेषु पित्तोत्तरेषु मोक्षे रक्तस्य विरेचनम श्रेष्ठा। तो मैडम जहां बस्ती विरेचन की बात कर रही थी पंचकर्म की, निश्चित ही उस पंचकर्म की जो बस्ती की व्यवस्था करें, उस बस्ती में हमें जो कुष्ठवैरी या कुष्ठ के कुष्ठग्न, जिसमें जो हमारे रक्त, त्वचा, मांस और रस, हमारी अग्नि को रसाग्नि और रक्ताग्नि को जहां अपन प्राकृत अवस्था में लाए, उस स्थिति में कुछ अच्छे रिजल्ट मिलते हैं। जहां तक पित्त के संबंध की बात है, जैसे पटोल और महामंजिष्टादि, ये दोनों अच्छा काम करते हैं, दोनों योग। आजकल इसकी घनबट्टी भी मार्केट में है, हम काढ़ा नहीं भी बनाए तो घनबट्टी को लेके गर्म पानी में डाल के भी पिला सकते हैं। तो इस तरह के छोटे छोटे अनुभव रहे हैं। बाकी क्लिनिकली बहुत ज्यादा नंबर ऑफ पेशेंट्स पर ट्रायल नहीं है, जो संपर्क में आए उनमें प्रयास किया। ऐसे ही सूत्र के केसेस में भी हमें कुछ अच्छे रिजल्ट आए हैं। जैसे हमारी एक रिसर्च प्रोडक्ट आया है एमिल का, उसके अच्छे रिजल्ट हैं। साथ में एक पिगमेंटो टैबलेट चरक की थी, उसके रिजल्ट भी हमने देखे। तो इन्हीं उनके साथ के जो मेरा क्लिनिकली एक्सपीरियंस रहा है स्किन डिसऑर्डर में, उसमें हमें जो भी हमें घृत देना है, यदि वह घृतन प्रातः काल जैसे अपन चाय पीते हैं उस समय दें तो शायद बहुत अच्छे हमको रिजल्ट मिल जाते हैं। ऐसे ही 3 बजे जो हमारे नाश्ते का समय रहता है, 3-4 बजे चाय का, उस समय भी हम काढ़ा दे सकते हैं। और मैडम के द्वारा जो प्रस्तुत किया गया बिल्कुल क्लिनिकल ट्रायल और प्रत्यक्ष पूरा का पूरा रिकॉर्ड के साथ, उसके लिए उन्हें धन्यवाद। और इस तरह के अनुभव शेयर होते रहना चाहिए। थैंक यू सो मच।
थैंक यू सर,
धन्यवाद।
वेरी मच। थैंक यू शर्मा जी, थैंक यू वेरी मच। नाउ आई वुड लाइक टू रिक्वेस्ट Professor V.K. Agnihotri sir for his concluding remarks.
Thank you, Dr. Sharma, Professor Sharma ji.
Dr. लीना कार्यकर जी कुछ बोलना चाहती हैं क्या? I hope I am not audible. Sir, Agnihotri sir.
Yes, I found that after the presentation of our regular guest speakers, the submission in a form of therapeutic direct personal experience by Dr. Gundatne madam is very important. As far as the theoretical concern, Dr. C.P. Sharma sir also shared his experiences along with the views. I found that since it is a so grave disease and when it starts, it spreads like anything, especially the back area, means of body, front area, cover any area. It starts right from the temporal part of the, say, ear or skull. So if the Panchakarma therapy or system is not available at that center or the center of the practitioner, oral therapy, as per the indications given by Dr. C.P. Sharma at early morning bed tea time, then again snacks time, means that rather the tea can be avoided and it can be replaced by the especially kala. So it will affect in a deeper way, and along with some Ayurvedic preparations, nasya, and overall the patyahar. Patya is important because in general, Krimignin Varga, Kushtagna Varga, medicines, Aushadhiyan are much more described in our Sangitas. So they can be used in a regular way on monitoring basis, that the dose, the timing which has been given to the patients, how much it is giving the response, 10%, 15% in first 10 days or so. Then a good continuation of treatment, say 3 months, gives encouraging results. So overall comment is that really I agree with the Professor Pawan Sharma's stand and rather experience that day by day we are becoming so experienced and knowledgeable simply because of few people's contribution, that the persons coming from different walk of life with different specialization of the fields, they are pouring their informations and experiences academically, clinically to our webinar platform, which results in a form of the enhancing of our knowledge of different subjects, conceptual, clinical, pharmaceuticals, and all that. So all the guest speakers who presented today's their views are really appreciable. They made all efforts regarding the etiology, types, fully spread knowledge pertaining to the management and the treatment. So is the contribution in a panel discussion with our guest speakers, our floor speakers like C.P. Sharma and all. So I extend my heartfelt thanks to all the guest speakers who spared knowledge, and our panel discussion big guys, along with all participants who joined today's webinar and will see the our archives recorded, as well as those who were there in our live in YouTube. So thank you very much. Thank you. Over to Dr. Pawan Sharma.
Thank you. Thank you very much, sir. Thank you very much for your blessings. And thank you to all audience and experts. Thank you very much. We are meeting now on 1st November, Vegan Day. Vegetarian. Thank you. Good night.